Good morning, Uma. Hi, I wanted to wave to you.
Good morning, ma'am. Here, Development Commissioner Vandita ma'am is here, and I am Director of Women and Child, Priyanka Mary Francis. Are we audible, ma'am?
Yes, you are.
Thank you, ma'am, for
perfectly.
Good morning, Uma.
Hi, Swarna.
Hi, Uma. Finally, we meet.
Yes, hi. Thank you for joining.
Thank you for inviting me to the office, the WCD office, and Priyanka ma'am.
Hi, Revati. Hi, Renuka ma'am.
Good morning, everybody. Hi, Uma.
Morning.
Morning, Renuka.
Good morning, Vandita ma'am.
Good morning.
Morning.
Good morning, Renuka ma'am. We'll start now, ma'am. Yes, ma'am. Yeah, you can start, ma'am.
Do you want to come?
Yeah, please come here. Are you? She has the speaker there.
Good morning, everyone. Am I audible? Just check that.
Yes, we can hear you.
Thank you. Good morning, everyone. So violence against women is often known as a gender-based violence because it partly stems from women's subordinate status in the society. Domestic violence is a severe challenge in every known culture and social group. Violence against women jeopardizes women's lives, bodies, psychological integrity, and freedom, and has been called the most pervasive yet least recognized human rights abuse in the world. Worldwide, along with women, domestic violence affects children, families, and communities. Therefore, SDG 5 is committed to ending all forms of discrimination against all women and girls everywhere. The Indian Parliament enacted the Protection of Women from Domestic Violence Act in 2005 to protect women from domestic violence. However, many varieties of crime mostly go unreported. Against this backdrop, this Southern Regional Workshop organized by Department of Women and Child Development, Government of Karnataka, against the violence on violence against women aims to demystify the concept of violence in no unambiguous terms and share experiences and challenges and best practices that want to optimize the service delivery for the service provider survivors. So now in this inaugural session, we have Dr. D.N. Manjula with us. She is the Secretary of Women and Child Development, Government of Karnataka. She is a 2002 batch IS officer. She is currently serving as the Secretary of the Women and Child Development. And we have in this session as our keynote speaker, Dr. Renuka Vishwanathan ma'am. So she is belongs to a rare breed of Indian Administrative Service officers from Karnataka. It goes without saying that she has broken many barriers to her credit. She was a member of the Planning Commission of India and the first woman Deputy Commissioner in Karnataka, posted in Uttar Kannada districts, and subsequently posted in Dharwad districts for a second term. She was the first woman to become the Managing Director of the Karnataka State Finance Corporation and the first woman Transport Commissioner of Karnataka. Before retiring, she held the coveted post of the Secretary in the Cabinet Secretariat of Rashtrapati Bhavan. She completed her doctorate in public finance from the French at Paris University. She is a prolific contributor to the Economic and Political Weekly. I mean, she is a prolific writer and researcher as well. So we welcome you, ma'am, in this program. We have the inaugural session will be presided by the Srimati Vandita Sharma. Ma'am is a 1986 batch IS officer of Karnataka cadre. She is a presently additional Chief Secretary Development Commissioner, Government of Karnataka. During the second wave of the COVID pandemic, she was appointed as the nodal officer to oversee the COVID-19 vaccination program for the state of Karnataka. And we know that how successfully the program was run. So we welcome you, ma'am. And now I hand it over to the Vandita ma'am. Ma'am, over to you, please. You are the president.
No, now Manjula ma'am will.
No, I mean, ma'am, she's the president.
Yeah,
of the
sure,
yeah,
sure, yeah.
So we'll request Dr. Manjula to speak.
Manjula ma'am, over to you for welcome address.
you, ma'am. Sorry, I'm not being able to attend in Bangalore because of another meeting over here. I'm in Udupi. Good morning, everyone. I welcome everyone to this Southern Regional Stakeholders Workshop on combating violence against women. Violence against women is an omnipresent reality that knows no boundaries of geography or culture. It is rooted in the gender inequality that women face throughout their lives from childhood through to old age under the aegis of patriarchy. Globally, an estimated 736 million women, almost 1 in 3, have been subjected to physical and or sexual intimate partner violence, non-partner violence, or both at least once in their life. India is not far behind. As per the National Crime Records Bureau, the crime rate registered per lakh women population is 56.5 in 2020, in comparison with 62.3 in 2019. Of the total crimes against women in 2020, about 1.1 lakh cases were registered under the category of cruelty by husband or relatives, and about 62,000 cases of kidnapping and abduction. Besides, there are about 85,000 cases of assault to outrage modesty, and 3,700 cases, more than 3,700 cases of attempt to commit rape. According to the National Family and Health Survey, 29% of ever married women between the age group of 18 to 49 years experience spousal violence. According to the 2018 data, for every 10 victims of human trafficking detected globally, about 5 were adult women and 2 were girls. And most of the detected victims of trafficking for sexual exploitation are females, more than 92%. Interestingly, less than 40% of the women who experience violence seek help of any sort, mostly due to fear, insecurity, stigma, lack of information, and access to justice. In majority of countries with available data on this issue, among women who do seek help, most look to family and friends, and very few look to informal institutions such as police and health services. Less than 10% of those seeking help actually appeal to the police. Violence against women, as you all know, results in significant costs to the state, victims, survivors, communities. Costs are both direct, indirect, tangible, and intangible. Violence negatively affects women's general well-being and prevents women from fully participating in society. Tangible costs include greater strain on healthcare, legal expenses, and loss in productivity. More importantly, regression results for estimating productivity loss due to violence indicate that women experiencing violence earn 35% less than those not abused, representing another significant drain on the national economy. Violence against women is like a highly mutating virus, changes its form and content rapidly. According to the National Crime Records Bureau 2020, while crimes against women actually reduced by 24%, mostly due to prolonged COVID-induced lockdown, cyber crimes have seen a rise about 55%. Emerging data collected through rapid gender assessments on the impact of COVID-19 on violence against women confirm an ongoing shadow pandemic. By October 2021, 52 countries had integrated violence against women and girls prevention and response into COVID-19 plans, and about 150 countries have adopted measures to strengthen services for women survivors of violence during the global crisis. Therefore, against this backdrop, this Southern Regional Stakeholders Workshop aims to demystify the concept of violence against women in no ambiguous terms and share experiences of challenges and best practices that optimize the service delivery for the survivors. I take this opportunity to heartily welcome Srimati Vandita Sharma ma'am, Additional Chief Secretary and Development Commissioner to this workshop, and request her to preside the inaugural session. I also heartily welcome Dr. Renuka Vishwanathan ma'am, former Secretary to Government of India, to this workshop and request to kindly deliver the keynote address. I heartily welcome Srimati Uma Mahadevan ma'am, Principal Secretary to Government Panchayat Raj, to the workshop, and thank her for all the guidance in organizing this workshop, in coordinating with all the stakeholders of different states. This workshop is organized with 7 panels of discussion on different subjects relating to combating violence against women. I welcome all the speakers from different fields of women empowerment and welfare to this workshop. I also welcome all the delegates participating from the various southern states to this workshop. Thank you.
Thank you, ma'am. Thank you for your welcome address. Now I request Renuka Vishwanath ma'am to kindly deliver the keynote address. Over to you, ma'am.
Thank you. Good morning, friends. Let me start with a disclaimer.
I am not, I have no professional experience in either in the Directorate of Women's Welfare or in the secretariats in Delhi or even with any women's commission in the state or at Delhi. I have only been a volunteer and an activist. I was on the board of Manushi, and I have collaborated with Donna Fernandez when she was in Vimochana and subsequently also. Whatever I say will be based not on any professional knowledge, but totally on my experiences as a volunteer. Yes, the problem of domestic violence is huge. It is there in all countries all over the world. However, as far as India is concerned, and certainly, I mean, this is true about Karnataka, whatever statistics we have in dealing with this problem is absolutely not useful because it is all wrong. When in the 1990s, some of us interacted with closely with the Commissioner of Police Bangalore, and we were asked to, we met the senior officers to monitor cases of domestic violence. Now, these cases were cases that we all knew about. They were cases which were reported on the front pages of newspapers, and these are cases which are concerned with the deaths out of domestic violence, which is a very small proportion of the total number. And these were cases with which Donna, for example, had actually dealt in every so that each person on that list was known to us. Now, we took the list and we went to the Commissioner of Police's office, and we found that a very well-meaning list prepared by the police did not carry the names of any of the persons who were on our list. The other very interesting thing was, however, that means clearly that the police was not classifying cases of domestic violence as cases of domestic violence. Subsequently, as Secretary Statistics, and anyway, because of my interest as a volunteer, I started talking to the State Crime Records Bureau, and I found that the State Crime Records Bureau had a number of proforma in which they were collecting crime statistics from the police stations, and these proforma were they were all prescribed by the National Crime Records Bureau. I went through the whole bunch of proforma, and I found a very innocuous-looking, interesting little statement which they were collecting, which was basically the cases of unnatural deaths reported in the police station, classified by mode of death. That statement showed a very interesting figure. The number of cases of unnatural deaths by burning was very high, and the number of cases of burning of women was very, very large. Now, and this statistic, in the police records anywhere in the country, you cannot conceal deaths. You may reclassify things in different places and all over the place, but you cannot conceal deaths, as we have seen during the pandemic when the bodies ended up in various rivers. So this information was actually available in the description of, in the classification of unnatural deaths, not as domestic violence cases. And in those cases, a certain pattern began to emerge. When I looked at those statistics, I collected it from various parts of Karnataka. And the interesting picture that was emerging, and also for various states in the country, because it was available in somewhere lost in the NCRB statistics. And what we discovered was that some of the southern states where the status of women, we know, I mean, by our own experiences, is slightly higher. That is in the northern states, or even in the southern state of Kerala, the number of cases of death by burning of women in that statement provided by NCRB, the number was low. While in some of the cases which in, say, well, you might say the Bimaru states, the numbers were pretty high. Now, I'm only putting this out as a statement of some of the statistics that are available. Subsequently, after my retirement, I did try to collect an updated picture of these statistics from the NCRB. The NCRB flatly refused to share the information with me. I would like any researcher who's there in today's discussion to perhaps try to see if the same kind of statistics is still being collected, and have a look at that, because that is certainly likely to be far a better window to understanding this problem of domestic violence. Why I'm saying is that the statistics of domestic violence that we have are totally wrong is because people, a minuscule fraction of those who experience domestic violence actually complain about it. And an even smaller percentage of them, of a very small fraction of this complaining group, is actually listened to by anybody. And of that group, an even smaller portion actually have some kind of, let's say, action or an FIR or any other kind of proceeding opened on the basis of their complaint. And of that, and even a very, very small proportion actually arrive, and this is important, after at least an average of 7 years of passing through various stages of criminal procedure at a resolution. And the number of cases which end up in conviction is absolutely, there's nothing, you can hardly count them on your fingers and toes. So this being the case, let us at least accept the fact that the data or the statistics that we are talking about doesn't really exist. It's whatever we use is completely inaccurate. For me, domestic violence has always appeared to be, I saw the victims of domestic violence, I still see them as like rats caught in a trap. When all of us here are trying to see that they are released from the trap and can make their life outside the trap. To get this done, you actually need to do a number of things. You have to make the rats aware that they are in a trap. You must ask them to find the little chinks in the trap through which they can get out. And they must be able to actually move out. They must have the mobility to move out. And outside, there should be a place where they can actually find a living which is far better than what they were experiencing within the trap. Now, if we look at it in this kind of from this angle, we will be able to work out the various measures that are required to liberate women to some extent from this trap of domestic violence. And we use some of these methods a little too much, and we don't use many of the others, which are just tools in our armory, which are underused and probably not used at all. And I would like to talk about some of those. Of course, we use the law. I know there are many practitioners concerned with law who are going to be in today's conference, and we think that the law is a solution. I think, yes, the law is a solution. It's not the most important solution, and it can never be the most important solution in India. At least it should not be engaging our attention all the time. After all, the law was always there. The IPC and the CRPC have got many clauses which clearly tell you different kinds of assault. It's been defined as different kinds of assault, and many of them are cognizable offenses. Let us ask all of us who are involved with law enforcement and who are probably part of this conference, to what extent they actually look at a woman who walks in with a black eye and books a cognizable offense on the basis of that, for which they do have the full power. It is not happening, and it will not happen. The other important one statistic which I think we should all face, because I found this and it horrified me. We introduced new sections of law to protect women, specifically under certain categories for domestic violence, even though the law itself had all those provisions. So we said, no, we should have some more. Now, what's happening to those provisions? We spend so much of time training people, guiding people, sensitizing people, monitoring cases, getting lawyers to courts, everything. Nothing has changed. After the 1990s and early 2000s, then I was actually putting my heart and soul into some of this voluntary work. I was terrified. I was scared. I was discouraged, and I did not want to see. Can you hear me,
I'm
please?
in this conference.
Okay. Others, can you please mute themselves? No, unmute Renuka, ma'am.
I muted the wrong.
Mute. Are you okay? Can you hear me?
Yes, ma'am. Please
Now we
continue.
can hear.
Yeah. Okay. So where was I? So I was terrified of this, of seeing another burnt body, another burnt, a destroyed young person's physique. And I dropped out of because it was voluntary. I dropped out of it totally. I had a good time, but I have been drawn back into it after a gap of 15 to 20 years. Now, again, I went through the series of conferences, meetings, etc., which were being organized by Donna. And forgive me for saying this, but my experience when I landed up there was a terrible sense of deja vu. I said, what's this? 15 years, 20 years have passed. It seemed to me then that nothing had changed. We were talking about exactly the same things again and again. And I'm being very unfair to all the people who have been struggling and fighting and working very hard during these 15 to 20 years. I don't mean to criticize them in any way. I'm only making this point as to say that the method of working through the law, I think we have come to the maximum of what we can all do outside the legal system, which is bigger than all of us, and which requires drastic change, drastic reform. But that is not going to be done through us, because our energies and efforts should not be totally sucked into changing something which will have to come in its own way by its own methods. And because the law itself is not going to deliver the full solution for the women who are suffering from domestic violence. So my one bit of information which I picked up during this period, which upset me terribly, was that the section 498A, and I'm just putting it to you. I'd be very glad if I'm wrong, but I'm not wrong. I'm sure about it. 498A was introduced specifically to protect women or to punish those who have inflicted serious domestic violence on women. And these are only the cases which end up in, let's say, death or near-death situations. I am willing to have an open offer here. Anyone, can you show me one 498A case that has actually ended in conviction? That's it. And if you can, I'm quite willing to understand how that has happened, because my experience, they never end in conviction. It's no point pursuing little bits of that 498A. The police will say the prosecutor will say the judge. It goes round and round. Doesn't matter. All of us here, we are not here to change the legal system. We can't do it. We have to work within what is the legal system. So that's it. And let's not waste our energies too much beyond that. Yes, the legal method is there. Let's try it. However, there is one chink of light, and I'm willing to admit that I was very wrong. When Indira Jaising and others were working for the Domestic Violence Act, I was a skeptic. I didn't really believe that act was actually going to protect women. Today, from my experience with those who complain about domestic violence, is that it is an effective act. It is an effective act, and my own instinct today, when anybody comes to me with a complaint of domestic violence, is not to refer them to the police. I always advise them, don't go to the police. You know what will happen. You will be sent away. You'll be told that you are going to get counseling, which inside a police station is just a joke. Counseling is simply sending you back to go and die and live with the same violence which you are experiencing. However, I will, and I often refer them to, under the Domestic Violence Act, to the Women and Child Welfare Departments. And I believe that part of the legal system should be strengthened in a very, very, with a lot of money, with a lot of additional people, because it is really providing relief, even if it is only a temporary relief. And more than the relief is, of course, on the one hand, that yes, you have certain rights, but the relief is also because the person who is inflicting the violence for the first time actually finds that he is challenged by some legal method, which is not a police station, but it still is very, very effective. And just the fear that he's challenged can make a tremendous difference. So I would believe that this is one place where a lot of resources must be demanded and must be put in, because it does provide real relief to women. Now, let me go on to the tools in the armory, which we are not using. The first tool which we are not using is information. And what I mean by information is the people who are in the vulnerable group. Of course, everybody is vulnerable. Violence happens against people of all ages. But the very important thing is the young people, those who are in high school, those who are in junior colleges. These are the ones who are stepping right into a situation where they may experience domestic violence immediately, and they are least prepared for it. Now, I have seen the extent to which just additional information is being provided in many other sectors, and it's been very effective. Children are learning that environment must be protected. Children are there's sex education in schools. There are young children who are being told about things like, good touch, bad touch, etc. But why is it that we are not telling our young girls that this is the kind of thing that can happen? It does happen to people of all incomes, all religions, all backgrounds. It can happen to you when you get into a marital or a relationship situation. And when it happens, this is the solution, and it doesn't require a very great academic package or anything. It's a small little thing, simple and small. And the second point, which has to be made to them very clearly, is that they must arm themselves in advance by being able to some extent put away, to have a cache of something, some money, some mobility, which will be the only thing that can help them if they ever catch themselves in such a situation. So I believe that information should become a standard thing, which, like sex education, should be provided to young girls everywhere. And this is something that the Women and Child Welfare Department can easily work on. The second point is, which I think is extremely important, is publicity. I belong to the generation that actually saw the family welfare program growing because of the information provided, because of the publicity by government, the red triangle publicity. We laugh about it, but the truth is that everything around us was plastered with the hum do hamare do message. And today, yes, we have succeeded, and a lot of it is due to the publicity. And I think that we have to do something exactly similar in the case of domestic violence. I did see on the TV some time back a few shots which some state government or maybe the government of India had brought out, which actually made domestic violence seem to be, which attacked domestic violence. So I think that a message based on this, that it is not cool to be violent inside the house, and that it is a crime and that you can be punished, that message should be presented again in all fora, exactly as was done with the family planning program. And I believe that we have a controlling law for media houses, which is unfortunately being misused by linking it to sedition and all other rubbish. Instead, what it should probably have is a kind of condition that every media house should have during prime time a few minutes of public interest publicity, and that public interest list should be very, very small. It should have probably elimination of plastic, it should have segregation of waste, and it should have no domestic violence. And that message should should be screamed at us from every part of the country, so that everyone realizes that violence is not cool, and that it's a crime and you can be punished. That is what I would suggest as a number two. The third one, which you are all discussing and which I think is very good, it needs a far greater support, is the halfway homes, the care centers to which you are opening, which both in the NGO sector and in the government sector, to provide a place where women who are running away from domestic violence can go and stay. And we need far more money than we have in those shelters, and far more support of all kinds for them. And this is being done all over the world, and nowhere is the money or nowhere the resources adequate. But yes, that is something that's happening, and I wish that would continue, and I'm completely in favor of that. The next point which I would like to make is mobility. I think the rat can run away only if it has a way of running away. I have seen some very well-off people who maybe even, who are very rich, who are not left with 1 rupee to even take a vehicle to go and complain about domestic violence. So the truth is, and they do not have the means. They do not have the means to run away from their houses when they are caught in a situation of violence. And therefore, it is extremely important that women should have mobility, which is right under their own control. The government of Tamil Nadu, as we all know, had done some 2-3 decades back. A wonderful director of women's welfare started this policy of teaching the young girls how to ride a bicycle and giving them free bicycles. When I went back after several years to my old university, I was stunned to see the roads lined with young girls cycling away. I was so envious of all of them. I said, how wonderful, because you do need one method of running away. And that's a second scheme which has actually helped in this is the Delhi government scheme of free passes for women in buses. When the scheme came out, my immediate reaction was that this will help a woman who is suffering a domestic violence situation to run away and to catch a bus and go wherever she wants. And believe me, that was not the intention of the Delhi government at all. It didn't strike them that this was a way out for the women in domestic violence situations. But I thought that that was a wonderful way of ensuring that women do have the mobility to run away. And the last suggestion, which I would like to make, which I've been making with Donna and others, is that we are only offering halfway house solutions, which means that the person trapped in the domestic violence situation is unable to, does not actually seek to escape from it because they cannot, their spirit is broken. They have lost confidence in their ability to run their own lives. They do not know, they do not, they do not realize, they do not even, they have been taught that they will never be able to earn even 5 rupees to stand on their own feet. And that confidence has to come to them. Without that confidence, you will still have a large number of unreported cases going on. And this happens to people at all levels again. Even those who are living under very, very rich circumstances, they have lost total confidence in their ability to manage on their own. So I think there should be a huge support component, which consists in advising the women who want to get out of the domestic violence situation, in assessing their skills, their potential, and in immediately linking them up to something that will help them to stand on their own feet. And I think there are hundreds and hundreds and hundreds of opportunities for women to do that, women of all income levels. And therefore, you need a serious career counselor, but not somebody who is dilettante or who is just theoretical. You need someone with hardcore experience who can tell you, look, start a kitchen in your house, or come and join a kitchen that we have of our own young people dying here. You will get at least 10 rupees, but it will be your own money. Or do some software development or some other this thing, because you have the intelligence, you have the knowledge, you have the background, and you will be able to earn that money. Of course, women are also saddled with the children who are their responsibility when they are abandoned or when they are attacked. But the knowledge that you will have a life outside and you can manage because others have done it, and you can earn something. It may not be something fantastic, but you still will be able to live on your own and you don't have to go back inside the trap. That is going to be a very, very strong incentive to let women out of this trap. And what I have discovered is something very interesting. The people who indulge in domestic violence are much less likely to indulge in that violence when they realize that the rat has a way of escape. That is the psychology which is most interesting. The violence becomes even more acute when they know that you have no way to get out. When they know that you have a vehicle or you know a way of going out, that there is somewhere you can go to and that you will continue to live there. While, of course, the legal proceedings, etc., all that continues. Let that go on. Doesn't matter. If you get anything out of it, you will get it after 7 years, after 10 years. But meanwhile, during that period, you're not left bereft. You're not left on the roads. Therefore, you are likely to leave. That knowledge itself will control the levels of domestic violence that the victims are today experiencing. So thank you very much. This is purely based on my own experience. I hope the ideas that I have shared can be discussed and may perhaps, and if there's any feedback, if there's anything else that people would like to contradict me or to question me or to completely tell me that I am talking rot, I would be very happy to hear that too. Thank you very much.
Thank you, ma'am. Thank you for that wonderful experience sharing. Quite a lot of information that you have shared from your personal experience on the ground, and quite invaluable in that sense as well. Now I request Vandita ma'am to give her presidential remarks. Over to you, ma'am.
Thank you, Priyanka. And a very good morning to everyone. And thank you, Renuka ma'am, for your very incisive and heartfelt and inspiring, I wouldn't call it a speech. It was something you really spoke from your heart, and it touched all of us. Thank you so much for that. First of all, I'd like to thank Women and Child Development Department for organizing today's workshop. It's, of course, very topical, not just because the International Women's Day is around the corner. It's also topical because I feel this subject is always topical. It's never out of vogue. I have no idea when we are going to say that we don't need to talk about women, their rights in the society, their need for protection, or the fact that not the need, there should never be a need for protection because it's a given. I have no idea when we are going to reach that stage. We've been talking about this over ages, and we have made some progress. I will not say we haven't. It's just not satisfactory. We really need to cover the end of the tunnel is nowhere near. So as far as women are concerned, ma'am has focused a lot on domestic violence. I would also like to say that, I mean, of course, domestic violence is a huge pandemic, and we saw its very, very ugly face during the last 2 years of COVID. Very ugly face. We have seen cases not being reported, huge spike in domestic violence, and our friends from the police department who are also there can vouch for it. It's a huge, huge problem which has beset our society, and it's been there since ages. Apart from that, we also have a huge problem of violence outside the home. That also we are seeing. That gets a little more publicity because of the media coverage, etc., and all that. However, that also should not happen. And the only thing which I feel has to be done, I mean, there's not one way, there are so many ways, but the basic foundation for us to get out of this whole rigmarole of looking down upon women, objectifying them, exercising violence against them, is that we need to respect our women. It's only when the woman will be given the same dignity and respect that a man gets in society that we can expect that all this will end. What is it that we can do to bring that respect and dignity to our women folk? And I'm not talking a very patronizing kind of a respect. Many people give that also. I won't say men or women. I'll say many people do that also. Oh, they take good care of women. They protect the women. They're very fond of seeing that women are kept in very safe, ensconced places. That's fine. Thank you very much. And we want that also. Because physically we are weak. We are not weak either psychologically, mentally. God made us a little less physical, stronger than men. So because of that, we need that also. So that has to happen. However, it is in the mind and our characters that we have to build. An inbuilt respect and dignity of women is a given in society. I think only then we can reach where we want to reach. Now, to do that, what is it that we have to do? There are so many things. Now we are sitting here in the government. We have seen government we are working within the government. We have seen the atmosphere within the government. I'll not even talk about it because there's nothing to talk there. It is the same. After all, government is also a part of society. So we have the same problems. The issue is, what is it that we can do? And what is it that all of you who are there with us, who have joined hands with us, the non-governmental people, also can do? So let's look at it in a constructive and positive manner. Yes, we have not come a long way. We have come only a short way. We still have a long, long way to go. But still, let's go on taking our steps. Let's try to make those steps bigger, larger, faster. And what is it that we can do together? We join hands and let's discuss that. And in that context, I think today's seminar is very important, because I find that the participation and the topics, the panels that Priyanka has made, they're very, very good. The discussions will focus not only on government interventions, but will also focus on how we dovetail our efforts with our partners outside the government, and what are the action points that can emerge from today's discussion. I'll be very happy if we can have a discussion subsequently inside, and we just try to see whatever possible we can do. Now, coming to one or two things, I know we are a little behind schedule, so I'll not take more time. I just want to mention one thing. Karnataka is probably the first state that has now set up a women's empowerment mission. And I would here like to thank Uma Mahadevan also a lot, because she worked very closely on that part. That mission has been set up under the chairmanship of the Principal Secretary, Women and Child Development, actually under the chairmanship of the Chief Minister. Now, I want to say this because we wanted to highlight the importance of women. It is not a department affair. Let's understand that. That is the second point which I wanted to highlight. The problems that women face inside and outside their houses, be it physical violence, be it psychological and mental violence, whatever happens, it is not the problem of just a Women and Child Development Department. It has to be shared and understood by all other departments and all other aspects where we bring in a lot of efforts into our society. Now, gender budget was started with that kind of an intent. It has made, to some extent, some difference, because some of the benefits that government gives are reserved for women in certain schemes. Okay, that is just one step. But we really need to get together and to see how we all can dovetail our efforts and bring in a knowledge about this whole thing in the other departments of our government also. And like like ma'am said, statistics are not really important. And first of all, they may be right or wrong, and I don't think they're right because they're not reported. So we are not going to go by statistics. The most important thing is IEC and education. We have to bring in the concept of respect for women right in our curriculum. Right from the beginning of the curriculum, we find that there are gender biases, and these are very innocuous, innocent gender biases which nobody even realizes. So these are some things which we have to see through a microscope, and we have to ensure that these gender biases are removed, number one. Having said that, we also need to bring in a concept of positive discrimination towards women, not only in our curriculum, but in every walks of society. We must understand, this is something which nobody seems to understand. You see, it is so important for men to understand that they need to respect women. There is no, ma'am was very right when she said that we need to walk out of the trap. The rats are in the trap, and that they have to be taught many, many ways of walking out of the trap. And we are trying to do a lot of things. There is a lot of things happening on economic, social empowerment, self-help groups, etc., etc. However, the trap should not be there. The most important thing is to remove the trap also. And the trap can be removed only when we bring our men on this page. Somehow women's issues are always treated as women's issues to be dealt with by women. And that is something which is totally unacceptable. Only when we teach the men folk in our society, when we teach the sons in our society, the boys in our society to respect women, are we going to get some outcome of this. I will not mention the name of a person, probably you may not like it, is a very senior police officer in Karnataka, who made his tagline in, I think, Facebook, saying, a real man is one who respects women. And I think some of the police officers who are sitting here and who are listening to this probably will recognize who I'm talking about. And he was trolled so badly. He was trolled so badly that he had to be forced to remove that tagline. That just shows the stark reality of our society. we are not only not independent, they don't want to give us independence. So the first step towards that independence is, I think, the education. We have to educate our men and our boys and our sons to see that women are equal to you. I'm not saying they're better than you. They're equal to you. That is one. Second, now the rat in the trap part. Yes, empowerment of women is so important. It is in our psyches. We are born like that. We feel that we are second citizens in society. And a whole lot of reinforcement takes place through the films, the social media. The kind of jokes in social media are so sickening. I think 90% of the jokes are against women. And it is so sad to see that many women only participate in those jokes. It's not, I don't blame them, because whenever I talk about it, they say, oh, your women only are doing it. It's not our women. First of all, they are your women too. Secondly, they are also part of the same society. They also need to be empowered and enlightened. They need to be told that this is not on. So the social media also has to be used very carefully to ensure that women are given the rightful place in society. So the empowerment of women has to be through knowledge and education, plus the economic side. Of course, legal side is also there, which is, like I rightly, Renuka ma'am has said, it doesn't work too much. It really doesn't work too much. To some extent, it works in very severe cases. However, the economic empowerment is really the second key to the answer. And in that respect, I would say that the government has taken a lot of efforts. A huge number of self-help groups have been created. Right now, even the government of India and the government of Karnataka is focusing very strongly on self-help groups and women's empowerment. And that is something which I think, of course, it's still a few drops in the ocean. I think it is making a very quiet revolution in our society at the lower rungs. And I'm not talking of the very rich strata of society, the middle class or upper middle class. I'm talking of the lower middle class and below strata of society. We find that there is an effort which has borne fruits through the economic empowerment of women through the self-help groups. Now, through this women's empowerment mission, we want to do something more. We want to use these groups, these clusters that have come together, that have a way of working together. They have an understanding with each other. We want to use these for social empowerment now. We must use and leverage upon this existing structure of social self-help groups who are working together for economic empowerment. We must use them also to empower them socially, to make them more aware of the fact that they are rats in the trap and they have to get out. And many times the doors are open also. It's just that we are not getting out. So a lot of issues we need to discuss on this. One of them is domestic violence. Other is the violence against women outside homes also. Why is it that a woman cannot come alone at night? Why? And why is it that our boys can come home alone at night? So these are the problems which we are seeing since Mahatma Gandhi made a statement about it. So we know since when this is existing, and it is still existing. It's getting worse actually. So we need to use our society and our mechanisms in society, which both the government has created and the non-governmental organizations have created, to ensure that the women learn to become much more stronger in their psyche, in their psychological thinking about themselves. They also need to respect themselves. So these are a couple of things which we need to work on. And therefore, I feel that we can chalk out a lot of issues. Today's workshop will probably come out with some concrete suggestions, and we need to work together on this path to ensure that a woman is never subject to any form of violence, be it looking down upon her, from there to physical violence, be it within the house, be it outside the house. So wish you all the very best. Thank you so much. And thank you for inviting me, and thank you for organizing this. And let's go ahead with this. I think we are already a little behind time.
Thank you, ma'am. Nevertheless, even if we are behind the schedule also, but the kind of inputs that are coming from all the honorable speakers here are wonderful. And Ma'am, I would like to inform you that as part of this conference, we are trying to bring out a document at the end of this discussions. Center for Women Studies, Bangalore University has kindly consented to help us in bringing out this document so that it will be like a guide to us in our future policy making and decisions that we can take up, ma'am. Thank you so much for coming and gracing this occasion and giving your valuable suggestions. Now we will move on to the first panel discussion, ma'am. The theme of this first panel discussion is basically it's a context setting panel, violence against women, where we are, what is done so far to combat gender-based violence, and what more to do. We have our esteemed speakers whom I would like to introduce, who will be part of this panel. Srimati Uma Mahadevan, IAS Principal Secretary, Panchayat Raj, Government of Karnataka. She's a 1992 batch IAS officer who was former Principal Secretary, Women and Child Development, Government of Karnataka as well. A voracious reader, champion of gender equality. She has authored multiple articles covering critical issues in the field of social justice. Her works always exude her deep passion for inclusive change. She was an active member of the working group who chartered the Human Development Report. And as Principal Secretary Panchayat Raj, she guides the 3-tier Panchayat Raj institutions in the overall development of rural areas in Karnataka. Welcome to this panel, ma'am. We had Meera Saxena, ma'am, former ACS GOK, as part of this panel, but due to some unavoidable circumstances, she couldn't be part of this panel. Next, we have as our panel speaker, Srimati Anita Gurumurthy. Srimati Anita Gurumurthy is a founding member and executive director of IT for Change, where she leads research on the platform economy, data and AI governance, democracy in the digital age, and feminist frameworks on digital justice. Anita actively engages in national and international advocacy on digital rights and contributes regularly to academic and media spaces. She serves as advisor and expert on various bodies, including the United Nations Secretary General's 10-member group in support of the Technology Facilitation Mechanism, the Paris Peace Forum's Working Group on Algorithmic Governance, Save the Children's ICT for the Brain Trust, and Mindaru Tech and Policy Labs Board. Welcome to the panel, Srimati Anita. Next, we have Srimati Revati Narayanan. She was associated with the Mahila Samakhya program in Karnataka for many years. She was State Program Director, Mahila Samakhya from 1995 to 2002, and a member of the National Resource Group as well. She has worked with several organizations on the design and implementation of empowerment programs for rural women and girls, women vulnerable to HIV/AIDS, elected women representatives, and women garment workers. She is currently Director of Capacity Building, Agastya Foundation, where her work includes gender sensitization programs for men. Welcome, Srimati Revati, to this panel. Next, we have Srimati Satya. Srimati Satya Devi holds a master's in women's studies and specializes in burns aftercare. She began her professional life conducting investigations for a study titled Unnatural Deaths of Married Women, and has been an integral part of the advocacy campaign to completely revamp the burns ward of the Victoria Hospital. Satya has been working to provide social, emotional, psychological, financial, and legal support to survivors of burns for almost 24 years. She, along with her team, has also launched a single window program at the burns ward, which is a one-stop center for all the needs of the burns. She has been an integral part of several advocacy campaigns, which were successfully able to better the lives of burn and acid attack survivors. Apart from being the program coordinator and spearheading Aveksha's intervention at Victoria Hospital, she also currently serves as Aveksha's secretary. And I am Priyanka Mary Francis, Director of Women and Child, Government of Karnataka, who will be moderating this panel. Now I request Uma Madam to kindly give the opening remarks. Over to you, Uma Ma'am.
Thank you, Priyanka. And congratulations to WCD for organizing this amazing session with very, very exciting lineup. And I'm sure many constructive suggestions that will come in through the day. Already the inaugural panel with Renuka Vishwanathan ma'am and Vandita ma'am has been very, very exciting. Manjula has set the context with the data, and I think the day promises to hold some very, very interesting discussions. I will not dwell on the points that have already been made. Suffice to say that NFH's 5 findings are great cause for concern. I will make 4 brief points on what especially as Principal Secretary Panchayat Raj in this sector, what potential is there to bring some change. First of all, in the area of decentralization, Karnataka has made progress, and we today should remember that Karnataka brought in 25% reservation for women as early as the 1980s in the Mandal Panchayat Act. In 1993, after the 73rd Amendment, Karnataka was one of the states to bring in 33% reservation. But over the years, in 2010, we further amended the act and brought in 50% reservation for women in seats as well as in positions of president and vice president of the panchayats. Happy to say that Karnataka is not alone in this. There are today 21 states in the country which have 50% reservations for women in local bodies. This is important because this has happened quietly, responding to aspirations on the ground. What does this mean for Karnataka? For Karnataka, we have 1 lakh elected representatives on the ground, half of whom are women. The potential, as Renuka Vishwanathan ma'am said, the potential to inform, orient, and sensitize is tremendous. And this is something that we must take up. Inform not only about legal remedies, but also about the network of support systems, the network of halfway homes, Svadhar, Ujjwala, state homes, counseling centers, one-stop immediate crisis intervention centers, to inform so that women through different means and women leaders on the ground, grassroots elected representatives, all know that there are these networks of support systems which are available. Because we know that local bodies in Karnataka and in other states during the COVID pandemic have done tremendous work on science-based awareness, on effective COVID management, on taking forward vaccination, on relief and response, treating every individual person as a person with agency and with needs. And if local bodies can be geared into such action during a public health crisis, during the COVID pandemic, there is no reason why we cannot enable them and equip them with the skills and the information needed to address the pandemic of domestic violence and intimate partner violence. This too is an epidemic, and this is something that we can do. The second thing I think we should focus on is the importance. Research has shown over and over again that there's an important and critical role for informal social networks for women. Informal social networks of solidarity and resilience. Women who are bullied in the workplace, who are beaten up at home, who are harassed or discriminated in public spaces, need these networks of solidarity and resilience. And informal networks are just the right way to take this forward. To give you an example, the Matrupurna networks, the hot meals that are provided in the Anganwadis to around 8 or 9 lakh women, pregnant women and breastfeeding mothers. And in this context, we must remember that the WHO also advises screening pregnant women for domestic violence as part of antenatal screening. And therefore, Matrupurna social networks, the PHFI evaluation has, as the PHFI evaluation has shown, are important not only to reduce anemia and improve birth weight of babies, but also for better mental health of women and providing them these networks of solidarity. Similarly, we have the self-help groups in Karnataka. Self-help groups across the country are providing important sources of livelihood to women. But I think as in Karnataka being one of the pioneering states that worked on self-help groups, these also need to be used beyond livelihood to create social networks for women. In this context, I know Revati is here, Revati who did very extraordinary work on Mahila Samakhya. In this context, the importance of programs like Mahila Samakhya for grassroots empowerment of women cannot be overstated. These are extremely important, and it's a great stroke of luck for Karnataka that we've been able to continue the Mahila Samakhya program on the ground for several years. I think it's important that all these networks be energized and activated to act as first responders with a simple SOP. to inform women about legal remedies, about support systems, to activate the crisis helpline and counseling, shelters, medical treatment, show women basically that another life is possible. In this context, Vanita ma'am also spoke importantly about the need to engage men. There was a poster shared recently on social media about the circle of violence, where a young boy who's beaten up by his father or brutalized by his father, again grows up as an adolescent who starts learning that violence is an appropriate and easy response to difficult situations. And as a father, again, he becomes caught in this chain of violence. How do we break the chain of violence? I think we saw it in films. Popular culture has shown over and over again, films like Govind Nihalani's Arth Satya, that it's the chain of violence which actually traps men in these toxic patriarchal toxic roles of toxic masculinity. I think it's important to look at research again. Research, for example, by Professor Seema Jayachandran of the US and others, has shown that talking to high school students, a simple intervention, like as Renuka Viswanathan ma'am mentioned, talking to high school students, girl students, about the possibility and the very real likelihood of violence and equipping them with skills to respond and be resilient to this. Equally important, I think, to talk to high school boys and girls about shifting the norm, about school-based gender attitudinal change, even an intervention as simple as 45-minute sessions every 3 weeks over 2 years. This is an actual intervention that has been done in Haryana, has shown results. You wouldn't think that it's as easy as that, but it actually is an important and essential intervention that leads to improved outcomes. In a situation where we have something like 25% of child marriage in the country, becomes all the more important to reach out to young boys and girls even before girls disappear from the system and get into cycles of violence where they become these little rats trapped in cages. At the end, I would like to say, most important of all is the need for a feminist and affirming approach, an approach that allows women to make choices, to express their agency, and to take decisions that work for them in individual situations, and to respect those decisions. Once again, congratulations for organizing this discussion, and I look forward to very, very exciting and useful conversations. Thank you.
Thank you, ma'am. As you validly pointed out, ma'am, the confidence and the reassurance that women need in this age is to express themselves and to exercise their agencies. And in this, as you, as well as Renuka ma'am rightly pointed out, we need to bring in men also, because somehow even Vandana ma'am was mentioning that they are somehow feeling that they have to be real men only when they care for women, whereas it's not care what women are wanting now. It's equal respect and the dignity. So in this regard, one small instance I would like to remember from an interview between Shobhita Dhulipala, who is a Bollywood actress. She was working with Dulquer Salman. All of you must be aware of Dulquer Salman, of course. So they were working together in a movie, and Shobhita was asked by the anchor interviewer that was Dulquer very caring towards you during the shooting? And Shobhita immediately replied that I don't think as an actor I need care from my heroes or from my co-actors. So that has taken that comment has become very viral and taken the internet by storm, because that is the kind of answer that we need women to come out today, that we don't need anybody's care or protection. More than that, we need that we are equal participants in any kind of decision making, and respect and dignity is what today's women are looking out for. And I hope more such answers will surely come out from our young generation once they are equipped with the kind of information and confidence that the department is also looking forward to impart to them. Thank you, ma'am, for your wonderful words. Now I invite Srimati Anita Gurumurthy Executive Director, IT for Change, to give her valuable inputs. Over to you, Srimati Anita.
Yeah, thank you. It's an honor to be here and take part in a discussion that at the same instance is very moving and also extremely important in some ways. It's actually a privilege to also have representatives from government who speak the same language. I think that's exceptional in world over. If I really look at the way in which words like feminist were mentioned today, and I really think that there is a lot to do to work together. We at IT for Change have been working on the important subject of online violence against women for a few years. Distressingly, both in India and the world, such forms of technology facilitated gender-based violence have only become more intensified with the spread of technology. It's often stated that online violence reproduces patriarchal values, norms, hierarchies of the analog world. Well, this is certainly true, but it overlooks, I think, to a large extent, the way the online public sphere facilitates and enables new and dangerous ways to target women. So in some ways, I think the world of social media, which has gained widespread adoption, particularly now in local language content, along with the improved penetration of internet connectivity across India, presents very, very complicated and very radically new kinds of questions to what may be envisaged as strategies for women's empowerment. Our research in 2019 with about 1,000 young women who are adults in colleges across Karnataka, Kerala, and Tamil Nadu shows that more than 3/4 of these young women had faced harassment online or unwanted behavior. The situation only seems to have worsened with the COVID pandemic, and many people, obviously, as we recognize, have dubbed this a shadow pandemic. It's crucial we understand the ways in which the platformized public sphere and the affordances of virality, speed, anonymity, they structure communicative environments in the online public sphere. And my colleagues from the police department only know this too well. As far back as 2018, a senior police officer we interviewed said that today there will be rarely any crime that does not have a digital dimension. And so true that is. A research of abusive and problematic speech on Twitter directed at women in the public sphere, particularly women in political life. We actually did a systematic analysis during the pandemic of women who are in the public sphere, who are politicians. It actually shows that regardless of your political party affiliation, trolls are relentless. They are in fact incentivized to perform and partake in these hostile communicative environments. And the discriminatory treatment of women is repeatedly normalized through hateful speech, which is supposedly harmless. And as Vandita ma'am put it so rightly, this kind of ostensibly harmless sexism bordering on misogyny is something that's really getting entrenched in these online environments, which are not necessarily divorced from our real lives. The virtual in that sense is more real than anything else. And so what's been done so far at the national level, and what do we actually see? We've actually in recent times, very, very recent months, in the reprehensible instances of the Sully deals and the Buliba episodes, seen a widely held belief that these are isolated incidents and aberrations. But what's really true is the massive scale of this kind of violence, and it suggests the social structural antecedents of the epidemic of violence against women. One part of the problem is the lack of timely legal reckoning of the issue. Prevailing laws and the legal positions have remained largely rooted in a different social context, and fundamentally a different set of speech conditions. Today, hate speech is not just speech, right? It is memes, it's emojis, it's a lot of different things. And so what do you do about rebooting laws so that these coordinated harassment campaigns can be addressed through institutions of law and justice? So the transformation of the right to freedom of speech and expression as enshrined in our constitution has not really been sufficiently explored by the legal and judicial community. And that's a frontier, I think, that is, something that we all have to work towards. Train, our young judges who are in the judicial academies to perceive that these are really interconnected. The constitutional values, the constitutional guarantees of freedom of speech, have to reckon with freedoms for all. It can't be unfreedoms for women and freedoms for some people. This vocabulary, this gap in the vocabulary and imagination is something that is adding to the structural problems. And one matter of concern is that our research shows how we often in courtrooms regard gendered offenses through the lens of obscenity, modesty, honor, right? Why did you send the picture online to your friend? Why did you actually have to do that? Couldn't you have avoided it? This kind of pulling up girls all the time. We don't see these as violations of the right to consent, right to dignity, right to privacy and substantive equality. Now, I just turn to the last 1 minute of my contribution, which is where do we go? What do we do? And I'm also inspired to connect to questions of economic empowerment, which I'll do in the end. We need to understand that online violence stalls, completely stymies women's first order right to public participation. Any violation of this first order right needs to be characterized through the prism of dignity, privacy, autonomy, and substantive equality. We need to recognize that social media platforms are not neutral channels. We cannot individualize crimes against women. They are structural social problems, and therefore platforms, like Meta or platforms like Twitter, they carry a duty of care, and that needs to be enforced. And my colleagues from the police department will vouch for the extraordinary difficulty till recently, till our intermediary guidelines were amended, to even get any evidence, which is across jurisdictions, if trolls are originating from outside, the borders of India. This is a very difficult problem for forensics, for evidence gathering, etc. So we need to push our efforts to hold these platforms accountable. Their liability needs to be commensurate with the enormous amounts of profits they make and the algorithms that they actually generate in order to viralize misinformation and hate. So they have to be held accountable. Legal interventions should be targeted at platforms, and we are quite happy that the IT rules from the last year reflect this, including in the form of targeting non-consensual circulation of intimate images. The law can do vastly better, but the law is not enough. Even the programs that are targeted, like Cyber Safe Girl or Beti Bachao, I think we need to really shift a little bit out of the paternalistic tropes. And it's my duty as a civil society organization to, keep my government, on your toes. And that's why I also bring some critical perspectives of how programs can be bettered, and I'm sure these will be taken in the positive spirit. I want to finally connect to the question of economic empowerment and digital technologies, because without that, as Vandita ji rightly pointed out, this integrated social and economic approach is what is going to see a cultural shift. Firstly, we need to get all women, because they're all laboring women, onto social security platforms. So today we have efforts for enumeration like eShram. It's extremely hard to get women in the informal sector. We have shifted the vocabulary. It's fashionable to call them gig workers. We have to get them on board, and any exclusion from these kind of social security will be devastating for women. Secondly, I think policies to integrate women's SHGs into financial benefits and financial channels like fintech need to be really very well thought out with data rights for women. We have just undertaken a study of the National Rural Livelihood Mission's systems architecture design. How does the information systems look? And the backend integration with fintech companies is very worrisome. This integration to the market can be predatory. So we will see a repeat of what used to happen in the 1980s and 90s, and it still haunts us. The suicide of women who took so many loans of an order that they simply couldn't return back to microfinance and microcredit companies. Now all of this has migrated online. They're all invisible, and therefore the bureaucracy has to take note of this, undertake a research study to actually figure out what is happening on the ground of these predatory fintech mechanisms. And last but not the least, I think even as we enter into partnerships with companies like Amazon for promoting programs like Amazon Saheli and other things, we have to learn from other states. For instance, has the Amazon Saheli platform really benefited women, because the rates of commission that these proprietary platforms charge, the rates of the discriminatory algorithmic apparatus, the opaque apparatus that does not push the SHGs, in the ratings and rankings, but actually ghettoizes them into a part which nobody ever sees. This is really corporate largesse. It is not corporate accountability. And I would, in fact, then urge the government to really resuscitate and revitalize the cooperative sector and enable them to build technological platforms so that these initiatives can strengthen erstwhile cooperatives to become more contemporary and seize the opportunities of digitalization. Thank you very much. I stop here. And our organization is always available to work with the policymakers and others, other stakeholders in this esteemed podium. Thank you very much.
Thank you, Ms. Anita. Very poignant points that you have made, especially in the context of online violence against women. One sector that is often daunting and very kind of out of the reach of the normal practitioners, legal practitioners, or even the departmental people, because of the limited knowledge of the technology, or because of the limited hands-on experience they have in tackling such cases. So this is one sector where we need to strengthen our capacity down the line in the department as well as and across the other stakeholders like police and judiciary as well. As you very validly pointed out, the hate speeches which are coming out as memes and posters. The other day only, in the context of recent Russian-Ukraine war, we got to see in the WhatsApp that a poster of a photo showing the Russian defense minister as a male and the Western European defense ministers as female. So this is the kind of toxic posters that are coming out, which are explicitly exuding the basic substructural thinking and attitude that we have in the society. So it's not the poster or the memes, the technologies issue. It is our basic internal attitude and thinking and mindset, which we have to overcome. Thank you for bringing out all the nuances of online violence against women. Now I invite Srimati Revati Narayanan to give her remarks. Over to you, Ms. Revati. You are not audible. Please unmute and speak.
Am I audible now?
Yes. Please.
Yeah. Thank you so much. And it's such a privilege to be here. It's also a real privilege to be in the state of Karnataka, where we have so many IAS women officers who speak the language of feminism. And this has gone on. I mean, this has been there, I think, the last 30 years, and it has been such a pleasure to deal with all of you, whether it's Dr. Renuka, Vandita, Uma, Priyanka, everybody. Wonderful that we are able to work with people like you. Now, I would, yes, as we have said from the morning, it's still there. I wish we didn't have to speak about it. But let me start with something that was very heartening in the course of my work. Now, I have worked for several years with women and girls. I mean, I've been around a long time, belong with the dinosaurs. But of late, the last few years, I've been working with young men. And this is a quote from one of the young men in a training program that we had with them. So the question we posed was, you know, when girls get married, when young women get married, we tell them all kinds of things. Do this, don't do this, all this. What do you want to tell young men when they're getting married? And this was his response. Respect her choice of food, clothing, friends, religious practice. Always remember that she has spent the first 20 or so years of her life in a different place. We cannot expect her to change everything after marriage. She must be an equal partner in choices about intimate marital relations, when to have children, and so on. This was a point when, you know, this is why this work sometimes throws up these wonderful surprises. This was a young man in our program of some 25 or 26 years old. And in Agastya Foundation, our focus of work is really, we work with children on sparking curiosity, creativity through hands-on science learning. We are not quote, human rights organization working in the classical sense on gender and development. But the point I want to make here is whatever work we have been doing on gender sensitization, mainly by expanding our POSH trainings, is throwing up things like this. So there is so much out there when we work with men. So the point has been made earlier, but at the practical sense, this is a huge area where we can make dents in this problem of women, violence against women, gender-based women, by working with men in a far more systematic way. And for this, I bring 3 examples of NGOs with interesting genesis. And now 2 of them, there are many of them, but I'm talking about this network called Ek Saath. And one of the prominent NGOs there is Sahyog, which has been working in UP on women's reproductive rights, gender rights, various things like this. And they started working with the men in the groups. And they formed these, I'm not going to state the obvious with a group like this who's so familiar that it's absolutely necessary to have the transformation of men in order to have empowerment of women. So they started working with men's groups on violence. Similarly, another example is Parichiti in West Bengal. So many NGOs have been doing this. Groups that have been working with women and the logical progression to working with men on gender issues. And they started taking up violence through this Ek Saath forum. They call themselves FEM. Many of you would be familiar with it, Forum for Engaging Men. And the third NGO that I would like to talk about is MAVA, because it has this really interesting genesis. It did not start like the other 2 that I mentioned. It started, and some of you would be aware, with an ad in the paper by a journalist called, I think his name was Gopinath. And the ad reads, this ad came out in the papers in 1991. Wanted men who believe wives are not for battering. If you're a man strongly opposed to violence towards wives from their husbands and would like to help stop it, then send us your name, address, and phone number if you have one. We are a group of journalists, media professionals, and social workers. Write in at once to, and they give a PO box number. Now, this is a totally different genesis of a group that is working against domestic violence, men against violence and abuse. Now, the thing is, they all have got together in a forum called Ek Saath, and they have been also making their presence felt legally in the whole thing, the exception to marital rape, that legislation which is now in the courts. And so in this, we see a practical example about how women's groups can move to working with men, use that platform. And this is very important in the context of the huge number of women's sanghas in Karnataka. Now, since I've always been in implementation programs, I tend to look at the nitty-gritty of the implementation. And what we have are, yes, the Mahila Samakhya groups, so they have changed considerably over the years. The Shri Shakti groups, it has been mentioned by both Vandita and Uma. So the thing is, these groups will form an excellent launchpad. Way back in the 1990s and early 2000s, when in Mahila Samakhya, we had started along with the Kishori groups, we had started groups for young men, for young boys to talk about women's issues. The thing is, where do these go? And how do we bring them all together? And that, I think, is our big challenge. There are, you can have the spontaneous genesis like the MAVA group, but I think we need to use the women's groups as platforms. But the thing here, and the caution I would put here is, there are women's groups and women's groups. Now, what happens once and this has been mentioned by earlier speakers, once the economic component of activities comes in, it's very, very easy to push feminist issues onto the back burner. And we saw this happening in Mahila Samakhya, we can see that sometimes sanghas start around economic activities and it's very hard to come to the feminist issues. So these are challenges that we need to look squarely in the face and see, have a plan for dealing with them, because it will not come spontaneously. There are very few programs like which started the way Mahila Samakhya started, which are with a very strong feminist approach. So how do we build that feminist approach? How do we get them to start working with men? How do we get them to start supporting men and boys? Now, the second thing that I would like to talk about is, you know, we talk a lot, and I'm completely, in fact, I was also thinking when I wrote down a few points for this presentation, talking about mission mode, about publicity that Dr. Renuka talked about in the morning, just going on flooding the messages. Because how do you break the silence? How do you get people to talk about it? So it's always, you know, I mean, I think all of us have faced it everywhere when we talk about this. Oh, these feminists have started again. Oh my God, all this doom and gloom about violence against women. How do we get people to talk about it? So the publicity is very important. But again, from the implementation standpoint, so where do we go after the awareness generation? Where do we go after the training? And there is the big gap. How do we link this to a sustained program of action on the ground, which will lead to long-term behavior change? You know, there's a small thing that, you know, we've been doing in our training programs, and I'm sure a lot of you do it, that at the end of all this, what's the action point? What's the action plan that will bring you to sustained behavior change? And I think there is a big pitfall for all of us. So, you know, when we go into mission mode, whether, I mean, I remember the heady days of the Saksharath mission, and now we have a women empowerment mission. The most, I think, the serious pitfall that we should watch out for, and how are we not going to fall into it? How will we take this from this point of well-intentioned, well-planned programs for awareness to sustained behavior change? I mean, we have examples everywhere. Peer-to-peer learning. How do you change it into a movement where it becomes uncool? Violence becomes uncool, and caring becomes, I mean, caring is the wrong word to use here. Treating women as equals is the cool way to go. So this is a pitfall that one has seen several times. The second thing is, how do you scale up from excellent NGO interventions to, you know, across the board? In fact, when we were discussing with Dr. Uma Mahadevan about, you know, the next phase of Mahila Samakhya, this was a big thing. That yes, we had the sanghas, we had the federations. How do we go to across the board? So you need resources, you need hands on the ground, you need mouths that speak the right language. So you need the people out there, you need the forums. Now, this brings me to my next point of forums. So there are forums where you're supposed to talk about gender-based violence, but you actually don't. And there are forums where you do not talk about it because you think it's not your business. So I'm going to give two examples, both of which I think, and I could be wrong, please correct me if I'm wrong, within the Gram Panchayat standing committees. So now we have the Social Justice Committee, which is supposed to talk about it. But going back again to my stint in Mahila Samakhya, we had tried at that time, we had a lot of women who from the sanghas had got elected to the panchayats. And we said, come on, revive the Social Justice Standing Committee. See, in all of this, I have to say that my information may be a little dated, but I don't think it loses its relevance for all that. If I'm wrong, just throw it out of the window. But in those days, we used to find that the Social Justice Committee hardly ever got activated. When it got activated, what did it talk about? So a Sangha woman who's been working, say, in a Nari Adalat, or who has been working in on issues of gender justice, would try to bring these issues into the standing committee. So what is the Standing Committee of Social Justice? What will it be able to do? Can we energize that committee to make a sustained effort on GBV? The second standing committee, and again, like I say, this is not based on recent field knowledge, and some of you may be able to correct me. There is a standing committee now on health and education. Are the links between GBV and health and education made very clear? Are they discussed over there? Are they bringing cases that are around in their panchayats to these committees, and is action being taken? So I bring these two up as examples of forums that can be used. They are supposed to be used. Forums that are not at present used, but could be used. Now, I've talked about scale. I would also now come to the point of documentation, research, and having a good clearinghouse. Now, this has already been touched upon by the previous speakers. Dr. Renuka has mentioned it. Now, the thing is, do we have proper data? Do we have data that we can keep using? We look for the data, we find it. But is there a high-power research center, which, yes, maybe it's run by the DWCD, maybe it's run in collaboration with a good, strong research department of universities, and is it giving you live, like pre-intervention, post-intervention, what has the change been? Is it giving you the statistics? Is it giving you data you can use on the ground? Is it giving you data to publish in all that flood of information that you are going to put out there through social media, through the conventional challenges?
Excuse me, Revati.
Yeah. Yes.
Yeah. So I request you to kindly.
Yes, I will be winding up. It's my last point. It's my last point. So here, looking at, for example, if one looks at an institution called the European Institute for Gender Equality, you see that their research is precisely around this, and they are supposed to be a high-power institution. So, they are looking, for instance, what are their research studies around? For example, how much do we all pay to deal with violence? How much is violence costing us? What we need to improve administrative data? Is female genital mutilation a problem across our areas, etc.? So, these are some of the points that I wanted to make, and completely in agreement with the intention stated by all the previous speakers. But then that in implementation, we need to think things through and make sure that we avoid the pitfalls of the past. Thank you very much for listening to me. And I really look forward to listening to the other speakers. And although, yes, there is a sense of deja vu that we are still talking about the same things, let's hope that this time we are off to a better start and we can get more things done. Thank you very much for your patience. Thank you.
Thank you, Revati.
If you don't mind, can
Yes,
I
ma'am. Please.
I'm really sorry, but I have another meeting at 11. These are the pitfalls of still continuing to be in the government and not having retired and having all the time. I will definitely take a briefing from Priyanka subsequently, and I want to use this this workshop as our giving us some very good outcomes for taking up further in the women's empowerment mission, because that is the first. Now we're just beginning with that, and we'll probably get a lot of inputs from today's discussion on that. So I want to thank Priyanka and everybody, all the speakers who are here. Thank you so much for joining in. Only one last point I want to clarify a little bit before I move on. When I said, that there's a lot of, some men talk to us in a very caring manner and very this thing. I want to distinguish between two types of care. One is a very patronizing care, and that is not what we are looking for. But there is a genuine care as a human being, one human being to another human being. I care for my children. It's not patronizing. I care for my family, my husband, my colleagues, everybody. It's not patronizing. That kind of care is most welcome. We want that. That's all, but not the picture. I probably didn't convey it properly. I just wanted to say that one small clarification before I leave. So thank you very much. And it's my loss that I have to go. I would have loved to sit here actually throughout, but I will take your briefing from you. Thank you so much. Please carry on. Yes, and sorry for interrupting, and no need to come.
Yes, thank you.
Thank you. All the best.
Yeah, thank you, Ms. Revati. Now I request Ms. Satya to take over and give your input. Satya, over to you, Ms. Satya.
Yeah.
And I kindly request to restrict yourself to less than 8 minutes because we are already running beyond the schedule. Thank you. Yeah.
Good morning, everybody. Today, I'll be just sharing about the kind of work Reksha has been doing for last 40 years with experience. Our intervention and the work at Victoria Hospital began in 1997, continuing with the concern on the issue related to the violence against women, domestic violence for that matter, for almost for 40 years. Our work with women victims of marital violence continued by responding to the particular needs and supporting them in the various ways. Then we began to realize that in spite of growing recognition that violence against women is a public crime, the number of women being murdered or for the dowry of who die under suspicious circumstances were growing. It was in this context that in year 1997 that we initiated a study and a campaign on unnatural death of married women, particularly in the city of Bangalore. We began our work with systematic study of the data collection. Based on this, we had to do a field visit, investigation had been done, and interview with the parents who had lost their daughter. And majority of the parents, they said that they believed that the daughter had been killed or subjugated to harassment and cruelty by the husband and in-laws, which resulted in the women committing suicide. So from this study, what we observed that was every month there was 100 women being dead under suspicious context. Then we had like women married from few months to few years. In many of the unnatural death case, which was reported as an accidental, when our investigation proved that it was not an accidental, but it was purely a kind of an homicidal or suicidal burns. Then the kind of a suicidal case, like which was reported of poison or hanging, clearly gave the cause of saying that it was because of ill health issues. But when our investigation proved that it was not the thing, but there was a kind of hidden stories behind that. Then what we observed was that almost after doing this investigation, we were almost 100 cases were reopened in this. And burns seems to be where number of women died due to burns were more compared to the other forms of death. Almost 70% of women die due to burns every year. Though she's been burned badly, smells of kerosene, yet the police do not visit to the site or anything of that, but purely says of stowers or the accidents, cooking accident, things like that or not. But incident, when you go to the investigation, you find that it would not have happened in kitchen or ill, but it would not have happened in either in the bathroom or the bedroom and elsewhere, And we also happen to see that the same stove will be used by the other family members, So these were some of the findings what we saw. And since at the simultaneously, we also, because of the campaign, we also had to organize a meeting with the community of parents who had lost their daughter. And this was going on a process, everyday process, or monthly once we used to meet them and find out a kind of a legal loopholes as such. Then we also started to do on these neighborhood committees, like we used to identify which area, the kind of a zone, because earlier it was only with 86 police stations, the 5 zones. So we used to particularly find out which zone had a higher number of death rates, and we had to go and have a kind of an awareness campaign there. And for the first time, House Committee book was also brought out. 2-day public hearing was also happened with regard to this kind of violence against women. Then from our organization, we had to do a truth commission for the women based only on the facts of this unnatural thing. Like not only from the city of Bangalore, but also we had to concentrate on Mangalore, Gulbarga, Ballari, Raichur, and Bijapur as such. Then, the more with regard to the legal aspect, there was a lot of loopholes with regard to the police investigation, the inquest, and for the inquest, and then even the kind of post-mortem reports which were delayed, and it was not getting into a proper thing as such. Then we also had to work on this kind of a dying declaration, which basically applied to the burns as such. Apart from this, we also the kind of an outwork or the work which we got from the unnatural death is one on the regarding to this medical delivery system, which was a campaign on the Victoria Hospital burns ward. Since everyone knows that Bangalore had a 2 dedicated burns ward as such, one was in Victoria, which was in the whole of South Asia, which can accommodate almost around 50 beds, while St. John's had only 6 beds. And most of the burns cases were admitted to Victoria, and the kind of things which were happening was really bad. One is kind of violence which the women were facing, and the other kind was the care and treatment which was not maintained. Along with this, we had a kind of corruption, the negligence, which had to be really looked into the names. So for this, number of protests has to be done, and came up with the kind of things like we had to form a burns committee along with the medical superintendent and with the under the principal secretary. So some of the changes were brought out. The thing is that like there was no separate ward for the children with the burns who come there, and there's segregation of burn percentage. Maybe either the degree of percentage is more, but there what you see is less percentage, the more percentage were all clubbed together, and so that was really difficult. And moreover, the burns ward was stationed in the first floor with a down casualty and emergency, and the mortality rate of the burns were more into that. And so we had to protest and we have to bring it to a kind of thing. This first, the renovation of the ward, which had to take place based on the percentage wise separate ward for the children, and there were no drinking facilities. The ratio of the doctors was so less. There were hardly few nurses who used to take care of the burns patients. So by bringing up a lot of changes, like which has been going on, and yes, the campaign also had continued, and now in 2015 June, at least we could see that now the entire ward of the burns has come to a burns building as such, with an ICU provided and things like that and all. But yes, still more have to be done, and yes, in this context, with the kind of a book which we released over the kind of experience what we had on the burns, like a burns policy also came into the existence. That's basically because with related to the burns as a public health issue, we have to see because the medical service which had to be provided, maybe with regard to the diet or maybe with regard to the treatment, and the burns was not looked into the way like how we look into another kind of disease as such. So burns policy, which we have been made with taking into an account of all the activist feedback and the doctor's feedback and our own experience at all. But to implement, I think really I need a help from all of you here, this place. Then from in Victoria now, in Victoria Burns Ward, we are actually seen into the kind of, and to go further step, we have seen now the burn survivors rate actually has come to a little better, but the kind of survivors who have come need to be taken into context with kind of an disability or the disfigurement. Based on that, they have to be provided some kind of thing which is not been doing it as like how we get an acid kind of in compensation. The burns are not eligible, they're not getting that kind of thing, and they have this kind of in benchmark with a 40% disability and things so that some of the burns patients are not eligible for that. So we have been trying out to see what could be done for that and all. And because of our presence in the Victoria Hospital Burns Ward, now the ward is made entirely free of charges, with admission being free and medicines. Of course, the lab charges also being made free. So now, and even during the COVID time also, we think that the cases are very less. No, during the COVID time also there were cases. But the thing is that earlier they were using the kerosene to burn themselves and all. But over periods, we saw that apart from kerosene, they were also using the petrol, diesel, tinner and things. During the COVID time, what we saw was the women were using the hand sanitizer to set themselves fire. This is to say that earlier men do not go to work and everything, women had to work. And here after the COVID thing, also the situation, the men says, yeah, because of COVID, we don't have any job and things like that. But the kind of violence the women were facing had to be driven into that kind of a situation where she had to set fire or she's been murdered by a life partner or the other partners as such. And yeah, now we have been just thinking of that. We have to again start doing on this unnatural death of married women again, because over years we have to see what are the changes and what kind of violence is being there. Because burns, yeah, we have been there to work, but with regard to the poison or hanging, we have to see what kind of crimes have been happening. So we have been just thinking of restart again. And also the kind of in police station of earlier there was 86 police stations, now we have almost around 112 police station and with 7 zones. So we have to work more on that issue. We have been identifying that, and also we want to identify the kind of a zone or the where the violence is being more. To end up, I would just say that we also want to work on this mental illness, because like most of the women, when they come with the kind of an injury, it is only the physical injuries which is being written, but not the mental violence what she's been facing. So this, I would really think that we have to work more on this. And at the end, I would like to thank Dr. Renuka Vishwanathan and Ms. Shobhan Ambition, who were really back behind a pillar on this kind of a journey which we have been doing over years. Thank you.
Thank you, Ms. Satya. That is wonderful from all the speakers of this panel. And I extend a heartfelt thanks to all of them for sharing their valuable experiences. Now, as we are running short of time, I request Dr. Sudeshna Mukherjee to take over the next panel. Thank you, all the speakers once again.
Good morning, everyone. So welcome to the panel 2, that is on the role of one-stop centers and 181 helplines in providing services to the women under distress. So as we see that violence is, perception of violence is highly subjective. Women often seek informal help when it comes to the intimate partner violence because of the sensitivity and so-called honor associated with the issue. Therefore, context-specific integrated interventions are essential in such cases to prevent vow. So OSCs are a vital intervention here. Both OSCs and helplines are indeed intended to support women affected by violence in private and public spaces within the family, community, and workplace. So panel 2 will throw light on the role of one-stop centers, 181 helpline in providing the services to the woman under distress. So this is one of I can say that this is the best of the panel, because we have all the pioneers who worked in this phase to make this particular scheme, that one-stop centers in all over the country. So as we have in this panel, like Dr. Sangeeta Rege, who is from the Sehat, Mumbai. We have Dr. Prabha S. Chandra, who is a professor and head of the psychiatry NAMANS. Dr. Arundhati Chandrasekhar, Dr. Raj Kachru, Srimati Nisha James, and Srimati Rani Shetty. So I, Dr. Sudeshna Mukherjee, I'm Associate Professor in the Center for Women's Studies. I'll be moderating the session. So for the panel, I first request Dr. Sangeeta Rege, who is currently the coordinator of the Sehat and has been leading the initiatives for health system response to violence against women, as well as integrating the gender concerns in medical education. She is the instrumental in setting up Dilasa, which is the first hospital-based crisis interventions, working in the KB Bhabha Hospital at Bandra. The Dilasa model is being replicated in 11 states, and Dr. Sangeeta plays a key role in development and implementation of the comprehensive healthcare response to sexual violence. Over to you, Sangeeta ma'am. We would like to know the challenges you have faced in implementing Dilasa, especially in terms of the public-private cooperation, and do you think that apart from Sakhi centers, do we need more and more privately operational OSs? Over to you, Sangeeta.
Thank you very much. I'd first like to say it's a wonderful audience here, and thank you very much for this opportunity. It's really an august gathering with all the esteemed IAS, IAS as well as academia right here. I had a couple of slides, and I was wondering if you permit me for about 10 minutes, if I could share my slides, or you would rather want to keep it as a Q&A?
Please do. It's already allowed.
Okay. So just give me and could you also please tell me the time so that I will match up to what is expected?
Minutes. I'm very sorry. We are
No problem. So I'll just pick up on a couple of things, and if there are questions, we could take that ahead. So thank you for this opportunity. As mentioned, Dilasa is India's first hospital-based crisis center, but as you've rightly pointed out, now it's funded by the National Health Mission in Maharashtra. Several of the Dilasa centers by other names have been established in almost 8 or 10 states in India. One of them being Karnataka, and I'm so happy that Arundhati ma'am is also here onto this panel, and I'm sure she'll speak more about it. Sehat continues to be a technical partner to most of these states, looking at really training, education, assistance, research, and documentation. So the focus will just be in my presentation to look at the role of healthcare workers and a health system's response to violence against women. I will go on to mention a couple of ingredients that make for a successful response to violence against women. I must say that I come from the response perspective and not so much prevention, as we work closely with the health system. And even within the health system, we could talk about secondary prevention, not really primary prevention that occurs at the level of communities. Some key evidence-related points from the emerging evidence from these Dilasa centers, and then a couple of recommendations. 3 clear, I would say, legal obligations for the health sector. We all know, so I'm not going to repeat them. There's the PWDVA 2005, there's the POXO 2012, and the CLA 2013. Subsequently, the Ministry of Health and Family Welfare, under the aegis of Keshav Desi Raju sir, who's unfortunately not anymore with us today, was really the champion for developing stellar medico-legal protocols in 2013, which very clearly make a mention of how trans people should also be responded to as far as sexual violence is concerned. I'm making this point because the CLA does not account for rape against trans people, but the guidelines still ask medical providers, nursing providers to sensitively care and respond, as well as provide medico-legal care to trans people. So quickly, what the roles of public hospitals are, as well as the Dilasa centers. As you see, any public hospital that houses a Dilasa center, in Karnataka, it's called the Mukta Center. In Gujarat, it's another name. I think in Kerala, it's called Bhumika Center. So they have different titles in different states. But corely, the responsibility of the public hospital is really about ensuring perspective and skill building to respond to violence against women across all cadres, not just doctors and not just nurses, but also support staff, in order to ensure accountability of this public hospital or health system, creation of a core group of healthcare workers, both doctors and nurses, so as to ensure institutionalization of a health sector response to violence against women, an appointment of a nodal officer, which I would say usually is a doctor, because in the hierarchy-based public health system, most departments are usually headed by doctors, and so the same, by the virtue of the same definition, most of these crisis centers have a doctor in charge who largely is an administrative person, providing oversight to the departmental activities. Establishment of standard operating procedures from the time a survivor of violence enters a health system to her exit. How should the health system respond to her? Creation of monthly reviews at the level of the hospital, along with the core group as well as the monitoring committee, to ensure adherence to the gender-sensitive care for all survivors of violence against women. The role of Dilasa would be to provide psychosocial care for women who are referred by the different departments from the hospital. They also receive referrals from outside of the hospital as well as from IEC material. A meticulous safety assessment, given the fact that women entering the health system are already facing serious health consequences due to violence. And so that really becomes, critical in cases of violence. Assist women by using the existing hospital infrastructure of police, child welfare committees, and so on. Coordinate with legal aid agencies, and that really requires a multi-sectoral response. The counselors, in these centers are equipped to understand linkages between violence and health. And so they routinely carry out OPD visits, IPD visits, and casualty rounds to actively identify women and children who could be facing violence. Establishing linkages with existing resources in the city or state. This is critical because even if Dilasa is a redesigned one-stop center, it can't possibly provide all services under one roof. And so establishing linkages with the police, child welfare committees, shelter homes, income generation, means, and so on. And lastly, it's creating awareness about Dilasa at the level of grassroots, could be auxiliary nurses and midwives, could be ASHA workers, and so on. So these are really the roles of both these systems. I'll quickly bring your attention to some of the data that we've generated from, of course, the first hospital-based crisis center in Bandra. But like I said that, now we have 13 in the city of Bombay itself. And I'm sure this data speaks for most of them, as well as the data that's emerging from Karnataka. So if you see the age profile, about 75% of women fall in the category of 18 to 35, largely the reproductive age group, who have an invariable contact with the health system, either for antenatal services, delivery, child immunization, contraceptive care, or they would also approach the casualty if there is a serious health consequence. So there is a small minuscule number of about 20-25% who enter the health system because of other health problems. And the pie chart next to the one on age actually indicates that. So if you see, about 48.8, which is almost 49% of women are coming directly from the hospital. And why is it so? So if you see, a large bulk actually comes from the casualty, because of serious injuries like cuts, burns, bruises, attempted suicides, and so on. OPD, which accounts for about 14.4%, is really about active case identification by healthcare workers, especially with antenatal women seeking healthcare. I'm sure everybody knows that the NFHS now shows about 8% prevalence of violence against women when they are pregnant. Then there is the active screening by the Dilasa team in different wards. So this is just to give you a profile and say that this is the burden, in a sense, of health concerns related to violence that is entering the health system and definitely needs healthcare. This is the impact of violence on women's health. So if you see, almost 40% are women with attempted suicide, another 40% assault. Then there are also covert signs of violence. And I would specifically like to make a mention of that, because when healthcare workers are trained, in the initial 6 to 8 months, they pick up the most overt signs of violence, which is assault, falls, burns, and so on. But as the training gets more nuanced and grounded, you also see them pick up more covert signs. So for example, how would you relate a TB to domestic violence if there is, for example, non-adherence to treatment, or she's unable to come for her medication? Those were the kinds of aspects that, healthcare workers have been able to bring to the fore. A psychiatric complaint, where she always comes unaccompanied. Vague aches and pains, and how do you associate that with violence? So those have also been more nuanced and incremental kind of identification of cases of violence over a period in time. Because women entering the health system obviously do not know that there is a hospital-based crisis center or a redesigned one-stop center, their mindsets are completely different from women accessing service from an NGO or a shelter or a police station. And so if you see here, about 40% of women have only sought informal support. And informal support can be qualified as going to the parents, going to friends, probably disclosing it to somebody who's close to her, but not really seeking formal support. Then there are almost 9% women who haven't disclosed anything about violence to anybody ever. And barely 5% women have sought formal support. And by that, it means going and registering a police complaint, a non-cognizable offense, a police, a diary entry into the police diary. So this goes to show that you are actually able to respond to women at an earlier stage, where it's possible that you can reduce trauma from violence and probably also reduce the intensity of violence if the health system is really well equipped to identify cases of violence and to provide support. Last but not the least, I'd like to say that health sector is just one sector to respond to violence against women. It can't possibly play all roles. And so what's really required at this point, I would say, is a seamless mechanism of referral in an interdepartmental means, which really does not cause secondary victimization for survivors or victims of violence. This really necessitates standard operating procedures or protocols for interface between different sectors, so that women don't have to repeat their history multiple times, they don't have to go multiple times to the police station to record their complaints, that their public prosecutor doesn't change every 6 months, that the PO doesn't send her to 5 different places. How does one really get there? And that's a huge challenge as far as the response. Yes, I will. So this is a huge concern. And just to add to the concern, while the health sector is putting its house in place in most places, I would say, I'm sure there is much more that we want the health sector to do. But despite that, there is a huge gap in how medical evidence is really understood by courts, by police, as well as by the judiciary. And so, when we make some progress with the health sector, where they do away with harmful medical practices such as the 2-finger test, the archaic comments on hymen and so on, the judiciary and the police repeatedly push doctors to provide this kind of explanation. And this is really becoming difficult across different states in India. And I do think that if there is anybody from the higher judiciary or from the Home Department here, this is really something that requires urgent attention. I'd just end by saying, as many of you said in the past, that as soon as the need of the hour is to integrate something at the level of pre-service nursing and medical education, because the doctors, if I may say, are not very hardened in their attitudes about patients. So it's quite possible to develop a more nuanced mechanism and communication skills so that you can really humanize the health system in that manner. So thank you very much. And I stop here. And if there are any questions, happy to take them.
Now I request Dr. Prabha Chandra, who is a professor and head of psychiatry in NIMHANS. And Dr. Prabha is also the lead for the Ministry of Women and Child Development Government of India initiative on training one-stop center counselors across the India in mental health and psychosocial interventions. Over to you, Dr. Chandra, and we would like to know the preparedness of the service providers in terms of taking care of the mental health of victims, survivors in the case of the gender-based violence. Over to you, Dr. Chandra.
Yeah, thank you very much for this invitation and this fascinating morning. I'm going to take off from where Sangeeta stopped, and that is the percentage she showed of people with women who seek help from Dilasa centers who have mental health issues and the high rates of suicide. And that is what sort of prompted us to start looking at what is the kind of training that one-stop center counselors really need in terms of handling these mental health complex issues that women come with. Do they really, like you rightly mentioned, are they prepared for it? And that sort of took us to a couple of things that we did during COVID. We had a large discussion with secretaries in the government of Karnataka, where we addressed the problem and said, what is really happening here? What are the needs? We initiated a study where we talked to counselors from all one-stop centers in Karnataka across the state, around 30 of them. And we got some very interesting findings. Many of them had very less training. In fact, they didn't even know how to identify anxiety, how to identify depression, what is trauma, how does stress manifest. So, as a result, they would constantly go into information mode and advise mode, because that is what they were more comfortable with. And we know that when women come to a one-stop center where they're highly traumatized, it's very unlikely that they're going to comprehend a lot of that information that is being given to them unless their sort of mental state is a little better. So that was one thing. They also expressed concerns about not being trained in telecounseling, and that because that was a huge requirement during COVID, and maybe going forward, that is going to be a very important method of mental health and psychosocial support, because we know that many women are not going to be able to travel. There's one OSC for each district. There are women in the periphery who can't come for so many reasons. We discussed the issues of mobility, not being able to have transport. So that was another huge thing. So that prompted us to, in fact, write a status paper and share it with with the government, and also prompted us to write to the minister in Delhi and to say that, look, this story must be the same across one-stop centers in the country, and we would like to take responsibility for training one-stop center counselors and indeed the staff on how to have trauma-informed care, how to identify mental health issues, and how do you support women who come to you for help. So before we start, so as a result, we're now working with all the 704 one-stop centers across the country. We decided to do one thing first. We decided to do basic training for all the staff of the one-stop centers, not just the counselors. So we are training from the security person, from the cleaner, from anybody, the woman who comes in contact with when she comes to one-stop center, because we realize that the counselor may be inside a room talking to somebody else. But the approach that the first level staff has to a woman will make all the difference for her to be able to feel comfortable when she comes in with such a terrible state of mind. So we finished basic course for the basic course, which is a 4-module course of 2.5 hours each. So about 15 hours of very intense training. Now, the training is very less didactic. It's very experiential. There's a lot of reflective thinking, focusing on myths and misconceptions. And we've been sort of, we've been quite surprised by the wonderful response, but we also know that there are huge variations across states, across districts, across cities, of the kind of approach one-stop center counselors have. So some of the things which have come up, which are quite important, and I'd like to emphasize, and this is from the data that we have garnered over the last 6 months, is the training needs basically a lot of concerns about managing self-harm among women, which Dr. Sangeeta brought out as an issue. And we know that in India, one of the strongest reasons for suicide among women is domestic violence. And OSC counselors find it very hard. In fact, they find it very difficult to manage that situation. It's very hard for them also. So a lot of time is spent in developing modules and training them on that. They have a lot of concerns related to working with the male perpetrators. So many women who come to the one-stop center counselors basically say, please stop violence. We don't want to leave him right now. We can't leave him right now. Just let the violence go away. That is their basic request. And for that, the counselors, in a very well-meaning way, often invite the partners or the husbands into the center and then just flounder about how to manage this high level of patriarchy, women blaming, and sort of just managing that dynamic which happens when you put two people together. So also focusing a little bit on when is it all right to call in a couple for counseling? When is it not all right to call in a couple for counseling? What are the caveats which are there with this kind of counseling? What safety traps might be there? How do you have to navigate the space with male perpetrators? So I think that has been a very popular session, and a huge range of attitudes also come out. The third thing, which Priyanka has constantly been telling us and which we are completely aware of, is the need for ongoing training. And that is something that the one-stop counselors have constantly talked about, that yes, we are very happy with this 8-module or 6-module or whatever you're doing, but what's going to go on, how do we go on with this? And I think that the government needs to have funding to ensure that the ongoing training happens. They would like case-based discussions. They would like somebody to sort of bounce their ideas with. They would like a peer network. So all of these things are something that I think going forward, we'd like things to be a bit more sustainable and develop methods by which that can be there. I am, Sangeeta has been talking so much about the health system response. The whole program, there is not a single doctor other than me and Dr. Arundhati. I think there needs to be much more response from the medical sector, because we know that women easily access doctors, easily access obstetricians. And that is one window that we have. So I think the health sector response to violence needs to be something which needs much more attention than what it has got, because there's another side to that, and that is the relationship between alcohol use and violence. Now, we all know that it is not that alcohol, all men who drink are violent towards their wives, or all men, sort of alcohol in any way is sort of protective or preventive. We know that there is an association. There are many places where men approach doctors for alcohol-related concerns. And if we can talk to them about aggression in those spaces and provide something for them to be able to manage their aggression, I think that is something that we need to focus on. The counselors are being trained in handling some of these issues with a great deal of sensitivity. And that's the last point that I'm going to make, that many times women come to a one-stop center, not just because their husband has beaten them or they're facing a lot of violence. There has been a whole lifetime of violence. They have witnessed domestic violence as children. They have faced sexual abuse. They have faced workplace harassment. And then now there is partner violence and they're coming. Sometimes one-stop center counselors tend to view things in a single window and are not able to sort of understand the whole lifetime violence, including transgenerational violence, or the violence that their mother has faced or their sisters have faced. So I think one of the things that we are trying to do through this very reflective form of training is to get the counselors to have a more nuanced idea about the role of violence in women's lives, and that cross-sectional assessment of anger, sometimes at the counselor, the emotional problems that they are showing is something that they are very aware of. The counselors have expressed great difficulties in dealing with women with intellectual disabilities or other sensory disabilities, and with women who have mental illness. And that's something that I think we need to be much more aware of in our training. So we are starting the advanced training on 8th of March for counselors across the country, which is a certificate course. And many of the, including feminist principles, trauma-informed care, is something that we are going to take forward. Of course, we would need an independent evaluation of this program. I think it's not just enough to train. I think it's important to understand what counselors have taken back, how their practice has changed, for which I would request the government of Karnataka at least to have an independent evaluation of the program to try and understand, has this made a difference at all? And what other things need to be added? How can we make, from NIMHANS, how can we make this thing sustainable? So on that note, I'm going to stop. Thank you.
Thank you. Thank you, Dr. Prabha Chandra. So now we request Dr. Arundhati Chandrasekhar, who is the IS officer and the mission director of the National Health Mission. So we request Dr. Chandrasekhar that she should reflect a little bit on how Karnataka shifted from this Galati to now this hospital-based Galati centers to this OSCs. And now it is almost all districts, they are having the presence of this independent one-stop crisis center. So over to you, Dr. Arundhati Chandrasekhar.
Ma'am, please unmute and speak. You're not audible.
Sorry. Thank you, Dr. Mukherjee. Good morning, everyone. I had a small presentation, but keeping in mind the shortage of time, I will just make my remarks brief. As Vandita ma'am said, in today's civilized society, we are still talking about violence against women. Primitive thing, but still it is there, and we have to live with it somewhere and see that how do we overcome. So Dr. Sangeeta and Dr. Prabha have already set the stage. I will not repeat the same things again, but to give a little bit of background in Karnataka, 2015 was our first hospital-based intervention where we started the Jalati centers through the Women and Child Development Department. This was basically had a counselor who would be in the hospital, a room was provided in the hospital with the counselor. Any patient affected by violence, domestic violence, or a rape victim, or any kind of violence could walk in. The counselor take any kind of counseling, any kind of medical help, refer to the concerned doctors, and she would be going back to her, handling to the police and other kinds of things, and going back to her house. Somewhere I think 2019, we visited the Dilasa centers. It was a combined team from health and WCD. I was then the director of WCD. Dilasa model was slightly different from the Jalati model. Dr. Sangeeta has already explained. So I'll not go into that. So in keeping in mind the Dilasa centers, we said that somewhere the healthcare response to the violence against women had to improve. We had to bring in the empathy factor. A woman or a child who's affected by violence walks into the hospital. That would be the first point of contact. She will not go to a police. She will not go to an advocate. The first point of contact would be the hospital, the doctor or the gynecologist or any other doctor. So we said, how do we integrate this? And That is how the Mutta centers were started. We had a MOU with the Sehat in 2021. It is now 1 year. We started these Mutta centers in 5 hospitals. These are basically different from the one-stop centers. I think Dr. Mukherjee would like to flag it to you that these are not same as the one-stop centers. This is more of the Dilasa model, the crisis center within the hospital, where the counselors are trained to be more proactive. They visit the casualty, they visit the OPDs, they visit the wards, see any patients, a woman who is admitted either due to a fracture or due to burns, a suicidal history, speak to them, try to elicit any history of domestic violence, then counsel them on the ways and what are the things available to them, services available to them, what is the method for them to, like Renuka ma'am said, to work out of the trap. So that kind of counseling, the counselors were trained. We had a 7-day training for the master trainers, doctors, counselors, staff nurses were trained in the physical format. They were here at the state level. We had trained all the doctors and nurses and counselors. It was a WHO approved curriculum of 7.5 days, including the refresher training. They went back to their institutions and we ensured that the training from the drivers, the ward boys, the lift operators, anyone who came in contact with a victim were sensitized to how to deal with a woman victim when she enters the hospital, how to identify a woman victim, and what are the procedures, how do you document it so that it would be useful later on for the legal counselors. Then how do you refer her to either to our one-stop centers or to the further women and child centers, the state homes or the Santwana centers, wherever she could get a temporary shelter or the legal aid or the police support that she would require. So this was more of a hospital-based intervention. We had a lot of challenges and teething problems. We have just completed 1 year now in these 5 hospitals, and we are planning to roll it out across the state. Lot of challenges basically because we are still working in silos. There is no seamless integration across the departments, like Dr. Sangeeta had mentioned. The police, the WCD, the health, to a certain extent, are working in silos. So the seamless, we are trying for intersectoral coordination. Vandita madam has been driving this. So even next week, there is a meeting scheduled for across the departments. One would be, we would look forward for the intersectoral convergence so that there is a seamless effort. The healthcare system identifies the victim, counsels them, prepares them for a further kind of counseling or support that would be required. The WCD offers the shelter and the other kind of support required, the livelihood required, and the police and the advocates provide them the legal support and other kind of support that would be required for her either to work out of the trap or to be financially or economically independent. I would just like to bring in 2-3 points before I close. Lot of things have been said about the violence against women and how do we go forward. Just like to add 3-4 issues. One, as I already said, the intersectoral convergence, where we work as a team and have one centers like Jainaga Hospital. When we started, we had a Revati center, we had a Mutta center working parallelly. Now at least only the Mutta center is working. So this kind of duplication is one thing. The other thing, like Uma madam mentioned, would be to bring this violence against women into the curriculum of the children, into the curriculum in the colleges. So how do you make it gender? How do you bring about gender equality? How do you do about bringing about the reduction in this gender-based violence? Somewhere the boys have to be sensitized at all levels. In colleges, especially in the medical colleges, a curriculum has to be introduced. I think Dr. Sangeeta sort of missed this. She has been an advocate of this bit. To bring this as a part of the curriculum of the medical colleges, so that the doctors who come out are aware of the gender-biased violence, the nuances involved. How do they identify? What are the things available for the gender-based victim? So that is something which not many people are aware, even in those within the government itself, except the WCD and the health departments. I think many other departments are not even aware what are the services available to such violence-affected women and children. So this curriculum, which brings in empathy, sensitizes the doctors who come out of the MBBS to be more empathetic to the violence-based victims would be one thing. The other would be creation of more and more peer groups. We have the school ambassadors through the National Health Mission in the schools to identify any kind of diseases or to any social evils like child marriages and menstrual hygiene. These are the things they pick up. But we never tell them about the gender-based violence or how do they, if they are affected by a gender-based violence, if they become a victim, what is the step forward? Or if they know someone who is a victim, what do they do? This kind of sensitization also needs to be brought into our curriculum. And the peer groups at all the levels needs to be educated on this. The sexual harassment committees in various departments, if they can play a more proactive role, then being more of a post facto, doing a post-mortem of an incident or a complaint, if they can play a more proactive role and sensitize the people within the department, within the offices about the gender-based violence, about the ill effects, also about the services available. That would be a huge step forward. And of course, like Uma Madam said, involving of our SHEs and our Sri Shakti groups, who are now more into the economic side, the livelihood side, to bring them back also, to sensitize them first, orient them about the gender-based violence, so that they play a role of the influencers in the society and are able to identify more and more people, so that before the person walks into the hospital or a police station or any other homes, they are identified and it is prevented at the primary stage itself, at the society level. That is where we need to step in and do something. That would be my thoughts on violence against women. We are looking forward to expand our Mutta centers across the state in collaboration with all the stakeholder departments. And thank you very much for giving me this opportunity. Thank you.
Shekhar, for very beautiful narratives of the trajectory of the growth of OSCs in Karnataka, and a very strong point for including that gender perspective in curriculum across, including the professional, medical, legal education, and everywhere we need it. Thank you, ma'am. So now we move on to our next speaker, Dr. Raj Kachtu. Dr. Raj Kachtu is associated with the schemes of universalization of women's helpline and one-stop centers from the time of inception of the idea in March 2013. He has done the pilot studies of these schemes in Raipur, developed their operating system software and implemented them in Chhattisgarh, Jammu and Kashmir and Assam. So Dr. Kachtu, being one of the pioneers in the field, I would request you to throw light on your idea of integration of services from receiving the call via helplines to effective rehabilitation, and of course, inclusion of academia in the data management and analysis. So over to you, Kachtu, sir.
Thank you. Thank you very much. Can you hear me clearly?
Yes, we can.
I have been listening since 9:30 this morning, full time with great interest. And just to make it just to make my point, I want to say that we don't have one-stop centers in India. We have 700 on paper, but we have only 3. And we don't have any women helpline. This is just a blunt statement, just to make a point. We, even in your brochure, everywhere I go around India, we call it a women helpline, but the scheme is universalization of women helpline. It's not even a helpline. It is an integrated system. What Dr. Chandrasekhar and few others talked about, we need a seamless integration between departments. And that is what 181 universalization of helpline does. On the very first paragraph or in between the scheme guidelines, you will see it is an integrated system of all helplines, government, private, everything. 112, 1510, 102, 108, 1098, 1090, all police stations, all hospitals, everything. So what does it mean? What it means is that you are giving a woman access to the state by calling any helpline that she can find. And if she cannot find a helpline, once she's in an ambulance or she has called police, one-stop center will automatically get to know about this woman. So one woman does not go to the one-stop center goes to the woman. It is the first change I want to see here. It's a slightly different concept, and that is why one-stop center 181 was created. Women don't go to one-stop center. They don't need to know who is going to do what for me. She accesses the state by whatever means. She walks into the local police station or she goes into the local hospital. We have one-stop centers in a district. How do we expect women to come all the way to the district and then report and then there is a lock there? We make use of what we call mobile phone. That is my strength. I want to use mobile phone. And I want to use it for any number. That's why mobile phones also have an emergency number. Even if you don't have money, you can still call 112. And that means one-stop center gets to know within 3 minutes, 5 minutes, there is a case, and one-stop center calls back. And what does one-stop center do? One-stop center tells this woman, madam, I'm your friend. That's why the Sachi system comes into the name. I'm your friend. I'm going to protect you from secondary victimization. And I'm going to give you access to justice. So one-stop center is an access to justice scheme. 100%, no less, no more. And it's one of the world's biggest and the finest schemes ever designed. I have absolutely no hesitation in saying it. I have worked 20 years in development aid sector worldwide. And I'm a 45-year software architect. There is nothing comparable to this in the whole world. What does it do? If you look at one-stop center guidelines, it tells you you do services. Services, it starts with FIR, assistance in FIR, assistance in forensic medical examination, legal counseling, Form 164, then legal counseling. Then legal counseling, it says specifically to stand up to your perpetrators. Then legal advice, rehabilitation, video conferencing facility to get to the judge. These are 5 steps of a criminal access to justice system. Step 1, 2, 3, 4, 5. All the 5 steps of the access to criminal justice system is the responsibility of one-stop center. It's not a hospital. It's not a police station. It's not a lawyer. It doesn't refer anybody to anybody. It represents a woman. Now, a woman gets to one-stop center, contacts a woman. I give you an example. In Jammu here, we have one-stop center. A woman calls from Riyasi, God knows where. It will take her 20 hours to reach there. She makes a phone call. She says, I have been thrown out by my husband or beaten by my mother-in-law, father-in-law, whatever. My child has been taken away, 2-year child. How can you help me? She calls 181 or she calls actually any 181 helpline here. The system takes over, calls her back. On the telephone itself, we ask her what is her story. While this story she tells, you finalize a DIR. A DIR is taken from there, is framed. While in 40 minutes of conversation, a DIR is framed. The DIR goes to the protection officer. If the protection wants to talk to this woman and if she insists, otherwise we will do the DIR ourselves. It goes to the local PLV. Local PLV registers, contacts this woman if she's in a remote area. Our legal cell writes the interim application, writes the petition. Within a week, a lawyer appears in PWD in the court. First day, we get under Section 23, a protection order, a residence order, a custody, counseling order, and an interim maintenance. This is not hypothetical. This happens. Your next session on PWDVA, this is what is the solution. You use Section 23 of PWDA that allows judges to give you ex parte relief on the first hearing based only on the presentation of your story. Can we not convince judges that this woman is helpless? And we get help. We get these things in Srinagar in COVID. 23 cases were done on WhatsApp, where we got a protection order, residence order from a judge. So the system, what we are talking about, seamless integration, is what is 181 one-stop center. 181 is like a mobile phone. We call it a smartphone. What we have is a smartphone. It's not a phone. If I say what I have is a smartphone and call it a phone, then I'm downgrading it to nothing. But smartphone is a phone plus my television, my data system, my WhatsApp, my everything. Similarly, 181 is an integrated management system. It's a state data center. All complaints from anywhere are stored there, monitored, looked after, and taken care of. A woman's contact point to the state is only one number, nationwide, everywhere. So all we need to do is tell women, remember one number, 181. That's all. You don't need to know how the law works, how this works. We will teach you. We'll counsel you, we'll teach you, we'll tell you, we'll represent you everywhere, whether it is PWDVA, whether it's police station, whether it's a hospital. Forensic medical examination. There are guidelines, but I know throughout India, not applicable, not being used because the states have not notified them. There are no guidelines throughout many places for women with mental disorder. So all these sector, prisoners. So what we need really is an integration of police, district legal services authorities, juvenile justice system, all the instruments of juvenile justice system. These three are main components of 181. And that is what the scheme says. Unfortunately, this scheme is not being used the way it has been designed. We don't need to redesign the scheme because there is nothing beyond. Ultimate. This is the ultimate. You call one number or you call any number, state will respond. It's the responsibility of the state to see whether this woman needs a shelter. I talk to the DC. If the DC doesn't give me a shelter, I go to the local magistrate and say, look, please give me a shelter for this woman. But woman doesn't have to go anywhere. I am there. One-stop center is there. One-stop center is the friend of the woman. And I personally take a lot of offense on this when I see one-stop centers in hospitals. A woman who has been done wrong is not a sick woman. You need to take her to a friend's house where there is nice furniture, nice food, television, where she sits in comfort. I have seen Bhubaneswar, hospital में वो तो उसको वहाँ तो गाउन भी पहना देते हैं बीमार का. And then there was 13, 14 girls, boxo, who दवाई दे के भेज दिया गया. What we need is, this is the design. And one-stop center, coming to your academic thing, is designed to be integrated with all universities, what we call knowledge centers, legal law college clinics, all rural outreach, ASHA centers, Anganwadis, paralegal volunteers, Mahila police volunteers, and anybody else on the ground. All they need to do is once somebody in the local region sees that this woman is in trouble or the first point of contact, she contacts 181, calls 181, a case gets registered, and the 181 system looks after that woman from there onwards. When we started Purna Shakti Kendra a few years ago, that failed only because of this, because once a Purna Shakti Kendra woman was approached, she did not know how to get to the system. Now 181 is there. It was actually designed for Purna Shakti Kendra 181. Later it's connected to one-stop centers. So I know I have very little time. I could tell you for several hours how this system works. But it's sufficient for me to tell you that 181 one-stop center is the largest and the most efficient scheme ever designed in India or in the whole world from the rights perspective. Women's rights perspective, one point of contact with the state. Not even America, you'll get it. And this is working only, unfortunately, in a couple of one-stop centers that we did as a pilot. Beyond that, it has never worked. So, to summarize, we don't need somebody say we need to redesign one-stop centers. There's no need to redesign one-stop centers. This is the ultimate. And this is the solution to all acts, whether it's PWDA, Dowry Act, POCSO, JJ Act, Amendment of 2013, Criminal Amendment of 2013, IPC, all of them are covered under this scheme. All we need to know is to read these paragraphs one by one. Most interesting, another part which I want to say, just one more point. This is a scheme that...
Dr. Kachru, you just have to wind up in a minute.
I'm done. Thank you very much.
Thank you, sir. Thank you, sir, for this very, eye-opening presentation. Really a lot more need to be done. So now we move on to our next speaker, Ms. Nisha James. She's an IPS officer of 2013 batch, very accomplished officer with many important responsibilities. Right now, she is the DCP administration in Bangalore City Police. So over to you, Ms. Nisha, and we would like to know that the City Police, as a part of their Smart City project, they are coming up with the one-stop crisis center. So we would like to hear from you that, how the police is moving towards this plan.
Thank you very much, ma'am. And thank you for the invitation to speak on this subject. First, I must admit that unlike the other speakers on the panel, I don't have any sort of professional great depth of expertise on the subject as such. So I will speak from a layperson's point of view. And from that point of view, I must say Dr. Kachru's presentation has been most enlightening because it really gives us a glimpse into how powerful the concept of the one-stop center really can be, along with the integration with the 181 helpline, where it is so simple a concept where the woman in distress or the child in distress may not need to know anything beyond 3 numbers, 181, just that they dial that number and the full force of the state is at their aid. So that is the beauty of the concept. But as a layperson, I can only maybe recount here my personal experience of how I have found one-stop centers to be functioning, which unfortunately, as Dr. Kachru has told, is far from the ideal. So I first recall my visit to the first one-stop center that was established in Bangalore, that was at Kidwai Research Center. So my good friend, Dr. Prabha Chandra, who's also on the panel, in fact, accompanied me to this visit. And out of curiosity, since this, as Dr. Mukherjee has mentioned, this concept of the crisis, one-stop crisis center is also part of the Safe City project. Out of curiosity, I wanted to visit the one-stop center to understand how it really works and how it's supposed to help women in distress. So I reached out to Dr. Prabha Chandra and I visited the Kidwai Center, which unfortunately took me at least 15 to 20 minutes to even find the center. Now we are talking about the subject of access, where one-stop center is supposed to be so easily accessible to women in distress, women who may be illiterate, who may not know how to get to a place, and really are in need of help and support in every manner that you can imagine. And for such a woman to find this one-stop center located at the corner of one of the quarters in Kidwai Cancer Institute, it was at the very fag end of the quarters complex, in a location where, despite having a driver, despite having of the police department, who is well aware of the layout of the city, despite having a gunman who was trying to get directions to get to the place, it took me 15 to 20 minutes to actually reach the location. And when I reached the location, I was actually quite astounded that it could be located in such a place. It was at least 2 kilometers from the main road. It was in the corner of one deserted sort of quarters locations of PWD, where I think nobody was even living except the center being located there. I spoke to the center in charge, and she expressed actually fear of staying at the premises because it was infested with snakes. So the center administrator, as you know, is a residential post where the officer is supposed to stay at the center at night as well. So when the center in charge of the one-stop center does not feel safe sitting inside the one-stop center, I don't think there can be a greater irony of the situation. So after this one experience, I'm happy to report that later it was relocated to Jayanagar General Hospital, which also had the fortune of visiting. There also I found, even though the premises was quite well maintained, staff was available, barring maybe caseworker being, counselor being missing and the police constable being missing, the other staff were available on the premises. But I still found that there were not very many women who were availing of the facilities of the one-stop center, even though it was in a hospital, well connected, at a central location. The whole issue is about women being aware of what services are really available to them in these situations. And unfortunately, that knowledge, that awareness is severely lacking. So even if the entire infrastructure, all the best amenities are provided, it all goes to waste if the person who is meant to be the beneficiary is not aware of those facilities being available in the first place. So taking these learnings from these 2 visits, we tried our level best to make the best possible adaptation of the one-stop center that we could within our limited resources. So under the Safe City project, there was a concept called the Integrated Support Center for Women and Children, where once I read through the concept note in the documents, I found that it was almost identical to the concept of the one-stop center. So that is when we thought that it, rather than reinventing the wheel, it would be best if we could propose the Integrated Support Center for Women and Children as one other one-stop center for Bangalore city limits, because there was only one in existence. So taking it forward from there, we approached the Department of Women and Child Development to recognize this as one more one-stop center and possibly locate the existing center to our location so that we could help it to be better functioning. So in our case, with the directions of the chairperson of the state level Apex committee, which was the chief secretary of government of Karnataka, we were instructed to have the center immediately be functional. So we had taken a location on rent basis at Majestic, which is the most central location that you can imagine in Bangalore city. It is the hub of all transportation. There is railways, there is bus, and there is metro all in one place. So it is the most immediately accessible location in Bangalore city itself. There we have, with the help of the Department of Women and Child Development, relocated the one-stop center. Aside from the staff of OSC being available there, from our department also, we have deputed one woman sub-inspector rank officer to be working in the premises. So the intention behind deputing our personnel to the center, aside from the constable who's supposed to be part of the OSC as such, was that all procedures related to case investigation of crimes against women and children would be able to be performed on site at the center itself, which would avoid the process of re-victimization, where the victim has to again visit the court to record their 164 statement, or go to the police station to record their 161 statement, or again go to court for their trial evidence. So in order to circumvent all that, we have tried to provide all facilities at this one center, where the sub-inspector that we have deputed would be able to provide those facilities services at location. So this would be the one place that the woman in distress would need to visit, where case investigation can also take place, where 161 statement being recorded by the same sub-inspector. We'll also have the services of a woman videographer, because as per law, most of these statements have to be videographed. So aside from that, during trial and during investigation as well, all statements that the victim has to depose can be done directly from the center, because we facilitated for a video conference link with the trial courts as well as the subordinate courts. So that facility also will be very shortly up and running. And aside from the usual services that are available in the one-stop center, even medical examination has been made available here, because we have nursing staff round the clock working in 3 shifts, and doctors on call who will come and perform the medical examination as per procedure at the center itself. So I'm sure we have still not reached the ideal of Dr. Kachru's imagination, but we'll definitely try and achieve that as far as possible within our limited means. So I'm sure there is a long way to go, because from what it ideally should be, whereas just one phone call triggers all the help that the woman requires. We are still a long ways from that, but I think we are like the efforts are definitely in place. So thank you very much. With this, I'll close my remarks. Thank you.
Thank you, Nisha. I hope you accomplish this very soon and we can have that what Dr. Kachru actually proposed. Thank you so much for your very meaningful intervention. Now we move on to our next speaker, that is Ms. Rani Shetty. She is the in charge of Parihar. Parihar is again a police-run helpline, that is the Vanita Sahayawani, which was established in 1999. So now it operates from the Office of the Commissioner of Police and accessible 24/7. So now we are handing over to Rani Shetty. And kindly please with your, you please throw a light on with your vast counseling experience for over the years, that how have you faced the COVID situation, whether there was a, I mean, though we know that there was a significant increase in the cases, whether have you faced that or what are the challenges you faced during the COVID time? And we would like to know that how to popularize, because as Nisha said, even the Kachru sir said, everybody was talking about that, making the things accessible and the popular, that people should be aware of it. So what are your take on the issue? So over to you, Rani madam, please.
Yeah. Good afternoon. Parihar is an NGO. It is an initiative of Bangalore City Police. Parihar is 28 years old NGO registered under the Societies Act. Parihar actually works for women and children in distress. Police Commissioner is the president, and senior officers, Joint Commissioner of Crime, he is the Vice President of Parihar, and DCP Administration is our secretary. She supervises Parihar administration and its activities, and DCP Crime, he is the treasurer and taking care of our organization. Parihar has 3 projects: Family Counseling Center, Vanita Sahayawani.
Just a little bit.
Come here. Come sit here. Sit here. Sorry. No, you are not. Please. Thank you. Yes. Parihar has 3 projects: Family Counseling Center, Vanita Sahayawani, it means Women Helpline, and Child Helpline. It's called Makkala Sahayawani. Family Counseling Center was started and funded by Central Social Welfare Board, New Delhi in 1993 and supervised by Karnataka State Social Welfare Board. And Women Helpline, Vanita Sahayawani, and Child Helpline, both the helplines are started by Bangalore City Police in 1999 just to protect women and children from difficulty situation. Our major work is counseling. Since Family Counseling Center and Women Helpline are with us, lot of people, you know, as we all know, women are not safe in 4 places: at home, public places, at workplaces, and social media. So women are being abused by in these 4 fields. Such women come to us. premarital issues. Before marriage, unmarried women, they're facing a lot of violences at home, outside, and workplace, on social media. They are the victims of, nowadays, they are being the victims of cybercrime. They come and give us complaint, that is premarital. After marriage, post-marriage, women are being abused physically, mentally, sexually, emotionally, financially, everything by their husbands and in-laws. When they come to our office, through counseling, we will actually give, hear their problems and give counseling. Through counseling, we will try to solve their problems, how to put them back in the family. All the cases cannot be reconciled or solved. Some cases need to go to the police station and some cases need to go to the, court. So we have an experienced team of professional counselors with master degree of social work. From long time, we have been working there for the last 28 years. So through counseling, we are handling this kind of issues. Same thing, some cases, since Family Counseling Center is working with us and we are doing family counseling, sometimes in some families, men are victims of domestic violence. They are being abused by their wives and in-laws. Such cases come to us. So if you see the ratio, like maybe men are like 20 to 25% come and give their complaints. And same thing, child helpline. We have a child counselor. She is receiving cases like behavioral issues. Nowadays, children are abused by known and unknown people. A lot of child abuse cases are going on, as you all know. So such cases are, coming to us, and custody battle cases. So counselor, through counseling, she will try to give them justice. If not, some cases, child abuse case or legal aspects, or children need shelter home, she has to take the support of Child Welfare Committee and solve these issues. Along with counseling, we also provide police support, medical facilities, short stay home, and psychological problems, rehabilitations, all these kind of services we are providing along with the counseling. And apart from the counseling, Pariyar also conducts a lot of seminars, workshops, awareness programs at schools, colleges, workplaces, and communities on women and child issues. Pariyar Bangalore City Police, Pariyar in partnership with the Bangalore City Police just started a skill development center, because Pariyar is, other than counseling, Pariyar has to empower women. So women who come to our office for counseling, most of them are not educated and they have talents. Due to some reasons, they are not allowed to go outside and to work. So that is the reason we have just started in with the help of police, Bangalore City Police. We have started a skill development center that is for domestic violence survivors and underprivileged women. In that center, we will teach the women tailoring, how to make paper bags, candle making, sanitary pads, and handicrafts items, etc. So all these works are going on in Pariyar, and Pariyar also networks with a lot of government and non-government agencies. And during COVID time, it was a new and very challenging job for us. As we all know, domestic violence cases were very high, and were not working, but we counselors, we worked round the clock. Daytime, our present counselors used to take care of telephonic counseling, because physical counseling was not there. Because of the lockdown, nobody was allowed to come outside and take the help. So through the through telephonic counseling, nearly 3,000 cases have been helped by us. And night, we appointed 4 counselors who worked in the night and listened all these grievances. Through the phone itself, we provided help to them. And that time, we had a very good support from the police, BBMP, Health Department, Women and Child Department, and especially One Stop Center and 181 staff. They were very supportive, especially 181 staff were very supportive in working with us in terms of rescue and placing some women who are thrown out of the house, during lockdown time. And they were very helpful for us in placing such women in government shelter homes. And some NGOs also offered a lot of help for us in our work. So in our 28 years journey, Pariyar counselors, we have helped lack of families and help them not going to the court for divorce or some kind of legal battles, and stop a lot of suicide cases. So proudly I can say that this much work has been done from Pariyar. All this work wouldn't have possible without Bangalore City Police support, and I would like to thank Bangalore City Police and for encouraging throughout the year Pariyar to do such a wonderful work in that place. And second thing, I would like to thank Central Social Welfare Board and the Karnataka State Social Welfare Board for giving us an opportunity to work in that department, and also thank all our donors and sponsors to run the center smoothly. Thank you very much. Thank you, Madam, Women and Child Department Director, and Dr. Mukherjee for giving an opportunity to come and share this work here. Thank you.
Dr. Mukherjee, can I get 1 minute of your time?
Yes, please.
Yeah, I'll just, because I cut it short, I wanted to, afterwards, the DCP said that this is imagination yet, but it is not. This is one of the schemes where the software was developed before the scheme was launched. So for 2 years, between 2013 to 2015, Ministry of Women and Child Development, together with our foundation, developed the software to be able to do what we are saying to be done. Only when it worked and it was shown to be working, then the scheme was launched. Because it would not be any sense to announce a scheme which cannot be implemented. So what this software does, it's a massive piece of software available free to every state throughout the country, and it integrates all the women and child development schemes, all MPV, MSK, Mahila Police Departments, Nari Shakti, Nari Portal. Then it integrates district legal services authorities. It integrates 15100 helpline. It integrates district child protection units. It integrates 1098 district level coordination center. It integrates police desks. It integrates emergency response. All this software is available, working and functional. So, and it's free. And it's given by the Ministry of Women and Child Development in the guidelines. So it is not something that we would want to see that it is something that we want to do. It's available, we just need to do it. So this is, I wanted to say, the technology end of it. It has been developed, and it's one of the finest pieces of software architecture in the whole world. Thank you.
Thank you, Dr. Kachru, and I hope we should make this soon a reality in at least in the state of Karnataka. So I thank all the—
Most welcome. We are always ready to be anytime at your service.
Thank you so much for your open, nice gesture. So I hope all the concerned persons are here. So we will soon be able to make it a reality. Thank you so much, all the resource persons for the panel, and we move on to the next session. And now I request Dr. Jyoti Vishwanath to take over, the moderator of the next panel, to take over. Thank you.
Yes, thank you. Thank you very much, Sudeshna. I'm here. I'm unable to unlock my video. The host has to permit it, I think. Am I audible?
Yeah, you are audible, but we don't find any such permission to be given.
You may switch on your own video. I think then it will be. Otherwise, you start.
We start off. That's fine.
Start.
Yeah.
Okay. Good afternoon, everybody. It's my extreme pleasure that I have been thought to be worthy enough to chair this session, the third panel discussion on challenges faced by police in providing services under Protection of Women from Domestic Violence Act, Dowry Prohibition Act and etc. legal issues and best practices in investigation related to violence against women. We have been hearing to many experts and the people from the field since morning. We all know that crime against women is not a new phenomenon. We also know that enactment of laws for protection of rights of women and for protecting her from crimes is always and has always been our priority. But apart from enacting the different laws, there are many other glaring issues like appointment of authorities, implementation of the laws, empowering these authorities so that they can investigate the cases under the concerned laws, empowering the investigating authorities with ample powers for prevention of crimes, the extent of coordination between the governmental machinery and the concerned private players like the NGOs, the specific issues, specific problems which are faced by the investigating authorities while exercising their powers under the concerned law, the specific problems which are faced by the victim women who are subjected to different crimes, the modus operandi of the investigating authorities, to what extent they use forensics while investigating. These and many more, much more are the practical aspects which we have to examine. With this point of view, in the panel discussion 3, we have great speakers here with vast practical experience. We have Dr. B. Sandhya, IPS DG, Kerala Fire and Rescue Service, Kerala. Welcome, madam. We have with us Dr. Rohini Katod Sepat, IPS Officer, Assistant Director, Indo Studies, Sardar Vallabhbhai Patel, National Police Academy, Hyderabad. As Assistant Director, she is present here with us. Thank you, ma'am. We have Sri Brungesh, Senior Faculty Member, Karnataka Judicial Academy with us in this session. We have Srimati Savita Thosar, Legal Advisor, District WCD Office, Mumbai with us in this session. We have Sri Krishna Prasad Das, Madhva sir, State Project Coordinator, Andhra Pradesh. Welcome to the session, sir. Srimati Jaina Kothari madam could not join due to her busy schedule. We have Dr. Sarasu Easter Thomas, Professor, National School of India, University, Bangalore. Welcome to you, madam. I welcome all the panel speakers to the third session. Dr. B. Sandhya, who is a law enforcement leader, she has a vast experience of 33 years in the Indian Police Service. Currently, she is heading the emergency services in the state of Kerala. The fire and rescue services in Kerala comprises of around 8,000 firefighters, 6,000 home guards. So such massive disaster management system, madam is heading and handling with vast experience in criminal justice system, police organization, and she also has participated in drafting of the Police Act. So with such vast experience, we expect madam, and we hope, we look at madam for sharing her experiences with respect to Protection of Women from Domestic Violence Act. Madam, I please welcome you to share your thoughts on this issue.
Good morning, everyone. I'm extremely happy to share my thoughts on the challenges faced by the police in providing services under DV Act and the Dowry Prohibition Act, legal issues and best practices in investigation related to violence against women. As we all know, the police organizations are in the forefront in providing immediate relief to the victims of dowry and domestic violence. And this is generally related to the social milieu in India. And we have a patriarchal society, so women do face discrimination on many fronts, and abuse, physical and emotional as well as economical are very common, and all these things are taken care of in the DV Act 2005. And while the different state governments enacted various rules to implement the same, and when we have looked back after several years of what has been happening after the implementation of the DV Act, we have found many hitches. Of course, we cannot forget the fact that for the first time DV Act had considered the abuse of sexual violence even within the marriage, and also the emotional violence, and even economic violence, and also compensation commensurate to the lifestyle which can be claimed under this act, which is not provided under the CRPC. So generally, the right to life and liberty as provided by Article 21, and also the right to dignity, all these things are very well covered under this law. But when it comes to the protection officers posting, or the definition of what is the matrimonial, shared household, etc., there are many legal problems, and many case laws deal with it differently. So many High Court, Supreme Court, etc. will be keeping on giving various judgments, which we are all supposed to uphold. And practically, when it comes to implementation of the law, the police officer do face many difficulties. Even the protection orders, while the police officers are going to implement the same, so we see that they are treating in different fashion, and so much of training is required for the implementation of DV Act, because police officers always have many doubts on how to take this. What will happen if the protection order is not implemented? Do we go for a warrant? And the victim also may not be knowing what to do. So this is a big issue. We had done, I think in 2016 or so, we had done a study also what has happened after these 10 years of DV Act, and all these hitches were pointed out by the police officers as well as sensitized lawyers, honorable judicial members, etc. So vague statutory language, then enforcement, existing and enforcement methodology, and appointment of protection officers, etc., adopted by various states. Then the cultural attitude towards the women by the police officers, the judiciary, etc., and the existing economic discrimination against the women, which is in general. These are all causing a lot of problems, and the same is true with the Domestic Violence Act also. Sorry, Dowry Prohibition Act also, which is a very old law. But this Dowry Prohibition Act also has very serious issues, as though dowry giving is prohibited, taking also is prohibited, but the cultural milieu of the nation that is called India has not grown up to the levels expected even after this many years. As we all know this, generally under this act, no cases are registered in many states. A number of cases registered under the Dowry Prohibition Act is very, very less in number. And even if somebody is reporting about taking of dowry or the things which are taken in dowry to be documented, etc., are pointed out, these are not actually implemented practically, and this is a sort of a lion without its teeth practically. So the sensitization of police personnel is extremely important as far as registering these cases are concerned, and extending the much needed protection, this shared household and all this in this regard, or whenever a domestic dowry a death is reported, when all these things happen, we need the police officers who are acting in a sensitized manner. So this acting in a sensitized manner, we require women as a critical mass in the police stations, all women police stations or whatever normal police station, women should be there as a critical mass. And not only that, we need women who are investigating the cases and implementing the law, but we need sensitized women. That's extremely important, I must say. Getting these men or women, sensitizing them is extremely important. We had actually planned this much ahead. 2016, we had planned along with the Women's Development Corporation to sensitize the entire Kerala police. We started a program. The program's name is Bodhyam. So first of all, we had to study what is the actual sensitization level of the police personnel, and accordingly we prepared a syllabus, prepared beautiful training materials and started it, and tried to give training to the entire police force, the entire police force of 60,000. And we found the sensitization level, including the women police, it is at a dismal level. When we were trying to ask certain simple questions like, do you think that a husband can beat up a wife when she is not properly cooking, when she is not looking after the children well? Including many of the women police personnel gave the reply that yes. So there are women police personnel also who think that their husband can give them a beating when they are not looking after them, or when they are not looking after the children up to the satisfaction of their husband or mother-in-law, etc. So this is an extremely important problem. So we can imagine what is the level of sensitization of the prosecution or judiciary, other sides of the criminal justice system, the society. So everywhere it's a multi-pronged approach. That's what is needed. So this multi-pronged approach needs a lot of gender budgeting. Starting with gender budgeting, a lot of things are needed to give real teeth to these existing laws. There are many judgments which are favorable. There are many judgments which again reiterate that many women are misusing this law, which is to some extent true also. But when it becomes generalized, that again becomes a big issue. So it's very easy to acquit a case or to deny protection on the judgment which can go on very thin lines. So ultimate result of all these things is that still there are many women who need a lot of help, and then institutional help also. If you are giving a shared household, you are giving protection. Then again, with small children, sometimes women find it extremely difficult to live in a shared household under threat. Every minute she may be under threat. So this police personnel may not be able to extend the help to that extent, which will really give her a protection. So sometimes institutional entry for the children along with the mother may be better. So assessing all these things, extending the help. So it needs a lot of real involvement of not only the government, not only the criminal justice system as a whole, but also the NGOs, the society as such. So that is the actual field level situation. And I think I have not much time left. So I will try to share a few slides on the best practices so that everybody can listen to that. 1 second. I hope now you are able to see my slide.
Yes, ma'am.
Yes, madam. Yes.
Thank you, thank you, thank you. So these are some of the best practices available across various states in India. So all women police stations are there. Tamil Nadu, Odisha, all these states, some of the states are having all women police stations where women can go and file complaints of domestic violence, Dowry Prohibition Act, etc. In some of the states it is useful, whereas in some of the states it's not useful. Exclusive women help desk may be available in many states. Then helpline numbers 24/7, emergency helplines are available. This Bharosa in Maharashtra, the one-stop crisis center. One-stop crisis center is supposed to be available in every state. But I think this Maharashtra model is working very well, because the staff from Women and Child Department, lawyers, from District Legal Services Authority, all are working in tandem with each other, so very effective. In Kerala also we have this KSWC, that Women Development Corporation Mitra helpline. So during COVID, we got around 20,000 calls in 1.5 months, I remember, which was very good. Then Women Cheetah Police is there in Uttarakhand. Beat patrols are there in many states, and women police officers visiting houses, panchayat, etc. are available in Kerala. Then this SOP in Madhya Pradesh, I am very much impressed. One ADGP is there in charge of this crimes against women for investigation. I have seen the rape cases being charge sheeted within a few days and all. And then even prosecution is being monitored. My batchmate Anvesh Mangalam used to head that department, and I had personally talked to him. I was much impressed the way in which they were not only providing SOP, but up to the logical conclusion of the case, they were able to extend all help and ensure that proper prosecution is happening. Then, of course, micro-level investigation monitoring of sensational and heinous cases is required, which is happening in many states. Then I have always seen we will be looking into the best cases in which conviction is there, but we have to study the trial court judgments of failed cases. That will give us some more insight. Then we have to have a lot of structural changes and physical infrastructure build up. So this victim suits are required, where a victim can go and have rest for one day, and even from there her statement can be comfortably taken. Then of course training and sensitization, etc., which every state must have all these things. And this integrated support center for victims of violence, then police prosecution, psychotherapeutic counseling, all these things have to work in tandem with each other. Then video conferencing facility must be available so that from this victim suit, the victim will be able to meet the magistrate, and that is so good. So a comfortable atmosphere, giving a comfortable atmosphere to the victim is extremely important. Actually, for child victim, it is so much required. Even for other victims, it is so much required. I have seen when it becomes in-camera trial, I have seen it became a gas chamber for the victim, because a battery of advocates from the accused, when the accused number is many, they come 20, 25 advocates come and sit, laugh at every moment. They laugh at whatever word is uttered by the prosecution or the witness, and not only the victim but even the witnesses, especially women witnesses, are intimidated in this gas chamber. So that is not the type of in-camera trial which is required. Actually, it should be from a suit where the victim is getting very good comfort, and from there, without seeing the accused, she must be able to answer the question of the defense advocate. These sort of system, I think we need in every state, every district court. We require such systems for children, for women. These are some of the things required. So within a short period of time, whatever I could present, I have been able to present. Thank you. Thank you so much for your patient listening. Thank you.
Thank you, ma'am.
Thank you. Thank you, Sandhya madam. Thank you very much.
Thank you, everyone. Thank you, everyone.
You have emphasized the importance of training the police officers, modifying and fine-tuning their attitude, and the relevance of sensitization, particularly of men, very well. And even the innovative best practices which you have highlighted, they really give us a confidence that things are happening. Of course, we have to go a long way, but things are happening. Very nice presentation, madam. Thank you very much.
Thank you. Thank you so much.
Thank you, ma'am. Now we have with us Dr. Rohini Katoj-Sepat, IPS officer, Assistant Director.
Dr. Jyoti, you are muted. Please unmute.
Director, Indo Studies, Sardar Vallabhbhai Patel, National Police Academy, Hyderabad, with us. Madam has completed her MBBS degree from Dr. VM Medical College, Solapur. While training at the National Police Academy, she has received multiple awards, including Trophy for Forensic Science and Trophy for Police Management Studies. And she has been declared as the best overall trainee officer in the 86 Foundation course organized by Adversity Training Institute, Mysore 2011. She has also worked at ASP Bhatkal Subdivision, Uttar Pradesh, and many other places.
No.
So I welcome you, Madam, Dr. Rohini, Madam.
Yeah, you can tell.
Can I start, ma'am?
Yes, Madam. Please, Madam.
Good afternoon to everybody. Good afternoon, ma'am, and all respected panelists, as well as everybody who's there joined here today. First of all, it is an honor to be invited and to be speaking to such an august gathering. And I'll be briefly sharing my experiences about what challenges we face, although Sandhya ma'am has actually summarized everything, every major issue that we face. But let us just for a very macroscopic level understand that what we are trying to do is we are trying to face a complicated question or a complicated problem. Here there is a victim and there is a female victim who has been exposed to different forms of domestic violence. Now, luckily by 2005, we actually got Domestic Violence Act, which defined domestic violence. Prior to that, domestic violence itself was not defined but implied. We had different types of legal sources. We had IPC, Indian Penal Code. We now have Domestic Violence Act. We have something very different known as, the Hindu Marriage Act and the maintenance. A lot of different things are there for this female or for a female who is actually a married female and has been exposed to some sort of a violence. It may be a direct violence, it may be mental violence, it may be economic, it can be anything basically. So what has happened through these times is we have tried to face and this complicated situation in quite a piecemeal manner. We have provided laws now, we have provided multiple agencies now, we have police on one side, we have NGOs, we have the entire district administration who basically provides support, runs all these centers. And we have a lot of other players like the prosecution in the criminal justice system, the judiciary in the criminal justice system that responds to it. But what happens basically when it boils down to an individual, a female who actually approaches us is, all of us also combined are never actually able to give her a clear picture. What I have seen in my 13 years experience as a police officer is, it is no longer a welfareistic orientation where we want to protect her, we want to support her. It is her rights. We are implementers and enablers of her right. Now, how is she going to exercise her right if she doesn't even know her rights? So most important thing that what I appreciate and what definitely in bringing all these stakeholders onto one platform is we all have stakes in it and we all have roles in it. What is our role at each individual level has to be known to the other partner. Because what typically happens is we try to overtake the administration in doing something. We will try to overtake the judiciary in doing something. But you have to understand that the core policing, a police role is to provide and protect the female or anybody for that matter. So for us, importance is that we should be able to understand the role of each and every person. We should be able to understand and give crystal clarity to the individual also that what is her rights. When a female walks into me, she comes to me with a problem. She comes to me with a situation in which, she has issues and there are something that is happening at her house and she wants me to basically give her a relief. But what everybody should basically try to do is basically give her the options, what she has. But majority of what I have observed in my interactions is we ourselves don't know what her options are. Whether she should go and file for a divorce, whether she would go and file for a Domestic Violence Act under that a protection officer, or she should go and file for in a police station. We definitely have, because we are a very cohesive socialistic society, we still try to believe and try to preserve this institution of marriage by trying to support it externally. My personal opinion says if it has to survive, it will definitely survive. We have to stand by truth. We have to stand by what is facts about the situation, and we have to stick on to what is our core competencies also. Because tomorrow, what has happened in all these, whether it is for women, whether it is for child, whether it is for any other section of the society, whenever a law gets framed for that, it is also liable to be misused. And what has happened across the things is now we do not have rights to arrest in 498A case. Why did it finally came down to the situation is that we also ended up having blindly implemented 498 also. So what my entire thing out of this entire point, what a point I'm deriving is that there are multiple stakeholders. We must try to appreciate and inform the female victim first, what are her rights. And once that entire victim decides, and it has to be her decision, it has to be her choice to exercise that option, whatever she wants to. We have the one-stop centers, we have helplines, we have NGOs to support her in this decision. But you have to understand that it has to be her decision to basically prosecute, go ahead with this further case, or basically get it to a final conclusion. Why I'm trying to tell it, because it has to be her cases. Sometimes we have seen in scenarios in which, a female comes to us, she reports against the family in 498, but she has no economic standing. Since she does not have economic standing, she has to bring up her children. She is obviously already under pressure for a compromise. And compromise also happens. And sometimes we ourselves get into this compromise situation, claiming that we are trying to save this family or we are trying to save this marriage. But what basically happens entire this is, tomorrow if she comes to us and says that, no, I want a compromise, I want to take back my complaint, I gave the complaint in a wrong behest. Whatever evidence has been collected till that juncture, may it be her photos when she has been beaten up, may it have been a medical record of her being badly bruised and taken to certain situation, may it have been anything. All those evidence becomes nullified. Tomorrow, if she takes the same evidence and goes for a divorce and asks for something, or she goes for the domestic violence thing, they do not carry value because she herself is saying that she has lied while giving it to the police. So my request and why I keep on telling is, we have to ensure and we have to be very crystal clear in what solutions are we providing as individual stakeholders to this entire thing. Police is definitely the most visible stakeholder. We are visibly there. We are the people who you can find police everywhere. You will not be able to find one-stop center sometimes, like Nisha was saying, that we have to basically, find where one-stop center is. We have to find where police helpline is, but you will find police officers. And like Sandhya ma'am says, it is no longer about a female police officer. We have to get out of that mentality also, that it has to be about female police officers only. Because if you actually scrutinize domestic violence, majority of the perpetrators are also women. It is very rarely against a male. It is always against a female member of the male family also. So we have to understand that there is no male and female in this entire thing. We as implementers of law also have to be extremely gender neutral and has to be extremely vigilant. Now in this, I'd like to just build upon what Sandhya ma'am said is, our own attitudes are our biggest interferences. When a lady or a female or anybody in distress approaches police, approaches NGOs, approaches the domestic, the protection officer, approaches DLSA, District Legal Service Authority, when she wants legal help, our own attitudes come into the picture. So basically delinking the attitude of the stakeholder, that sensitization, that kind of an awareness is extremely important to come down to it. And whether we want to do it in a propaganda fashion, we have to do it. Whether you want to do it in the way of awareness, you have to do it. But you have to finally basically come to an understanding of, if it has to be finally executed in the perfect manner, we have to understand that for that execution, individual has to be separated from the role I am. As Rohini, I might feel a lot of things, but as a police officer, as a superintendent of police, it's my moral responsibility to do certain things. I may feel that it may not lead to a conviction. I can just leave along the case. That is not my choice to make. That is, if a female gives a complaint, it has to be duly processed and it has to be duly presented. Similarly, a very important thing is, when we are trying to help and support her, is the most important thing is economic support, which I have personally felt in my entire experience as a police officer, is if she has the economics of supporting, she is going to take a stand and stay by that stand. The most important wavering happens when she does not has that kind of a support or an economic support to basically take a stand on this entire situation. So there is where this entire thing goes ups and downs. In criminal prosecution, I'm not going to be talking about Domestic Violence Act per se, because that typically is a forte of the protection officers, which is not a police officer. He's a separate person who is appointed by the state governments. For that protection officer, what all orders they can pass, definitely, I think there are other panelists also who are going to throw light on it. But I'll be focusing on police angles. My experiences as police investigation, what we face is majority of evidence that we present to court, like ma'am was saying, we do acquittal analysis. Why did it ended up in acquittal? Why was we not able to finally leave it to a successful conclusion? And majority of the time we found is we relied overtly on oral evidence, or what you call oral statements. She said, he said, that kind of a statement. So definitely the focus has to be shifted on to scientific evidences. And for that also, like all stakeholders are present, I'd like to revert the point that we have to educate the female that whenever she encounters certain bad incidences or certain incidences which she may feel that she has been hurt, it is very important to document them. She may not decide to file a case. She may never decide to file a case. But it's important is documentation of whatever has happened to her, and creating evidence in the sense creating scientific evidences to it. So definitely, like ma'am has given a presentation in which in Madhya Pradesh we have a very high level of micro supervision of cases in which these emphases are also given. So that definitely is a need for our in which we as police officers required to do our job very well. And then similarly, we do for us to execute and do our job very well, we require the help and support of other stakeholders. And most important, like Sandhya ma'am was also saying, is we have to understand her dilemmas also. If she files the case, where is she going to stay at night? Who is going to support her? What is going to happen to her future? Are those questions that are going to go or keep on going on in that victim's mind? And it is the state's responsibility to come up with a cohesive answer. We have had one-stop centers discussion. We have just went through the helplines discussions, NGOs. All of them are stakeholders. And as a whole, the state has to own up the responsibility of supporting her, because she is 50% of the population. She is 50% of the mandate. We are there sworn to protect her. So it is her right to be protected. And it is our moral responsibility as people sitting in this side of the fence as government to basically provide her that support in whichever means is necessary. But we also have to understand that we have to differentiate our own attitudes. We don't have to go to that welfaristic protective instinct that I have to save every woman. We basically have to educate every woman that she has a right to make the choice what happens in her life. So I think that was my points, because Sandhya ma'am has already covered majority of the other points, and there are other dignitaries also left, so I won't take much time. So I think that's from my side, Jyoti ma'am.
Yeah, madam, thank you very much. So after listening to you, what the things percolate down to something called as women empowerment, I think. Ultimately, the financial condition, financial capacity of a woman is very important, and they are going to govern her choice in all these matters. That's what I feel. So thank you very much, madam, that you have emphasized the relevance of victim-centric approach, the opinion of the victim, her anxieties, which are normally governing her choices whenever she is victimized under these laws. She's afraid, or she has certain anxiety, she's afraid of certain issues like breaking of family or maybe injuries, etc. So thank you very much, madam. Thank you very much. So, yeah, thank you very much. So I also invite now Sri Dungesh, Senior Faculty Member of Karnataka Judicial Academy, for sharing his opinion with us. Sri Bungesh sir has completed his law degree from JSS Law College, Mysore. When he joined the chamber practice with Sri T.V. Krishna Rao from 1991 onwards, he has practiced for a couple of years, and then he joined judiciary in the year 1998, and he has joined as a district judge from 2015. He has served as district judge in Chamarajanagar, Karnataka, and then he has been posted as senior faculty member of Karnataka Judicial Academy. So I invite you, sir, to share your opinion with us. Please, sir.
Thank you very much, madam. Ellarigu namaskaralu. Let me say my namaskaram to everybody in my mother tongue. Ellarigu namaskaralu. So now I'm very happy to be invited to this session to share my a little knowledge or view about this the concept how to combat the violence against the women across the country. Of course, if we read the preamble of this Domestic Violence Act, the object we get to see or we come to know that this act has been enacted to provide the more effective protection of the rights of women guaranteed under the Constitution who are the victims of violence of any kind occurring within the family and for matters connected therewith are incidental thereto. So every person in the authority, more particularly the judicial officers and police officers and protection officers and the service providers who are the who are bestowed with the duty are every now and then we are dealing with the victims of domestic violence, and we have to approach the problem with a spirit of sensitivity. The police officers who have spoken just prior to me have also emphasized much on this sensitization of all the police officers and the judicial officers. Of course, they did not say that word judicial officers loudly because of so many other consequences, I believe. But let me say that when we talk about the sensitivity, surely it includes the judicial officers also. And this is the object sought to be achieved by the enactment of this Domestic Violence Act, Protection of Women from Domestic Violence Act Violence 2005. So as far as the challenges faced by the police in providing services under the Protection of Women from Domestic Violence Act and the Dowry Prohibition Act and the best practices in investigation related to violence is concerned, the police officers have already spoken about the same wonderfully, and I acknowledge and endorse their views. As far as judiciary is concerned, in Karnataka, the Honorable High Court has already started a program. The nomenclature or the heading of the same set program is Gender Justice Program. And under that program, the Karnataka Judicial Academy, with the auspicious support of Honorable High Court of Karnataka, imparted training to all the judicial officers about the gender justice. In those training programs, sufficient sensitivity has already been infused to all the judicial officers officiating in different cadres, right from the cadre of lowest strata of the system up to the honorable judges of the Honorable High Court of Karnataka. Therefore, I am confident that the sensitization of judges on these issues will go a long way in combating violence against women. Of course, as far as the role of police officers is concerned, if we read the rules, the Domestic Protection of Women from Domestic Violence rules is concerned, Rule 12 and 13, they speak about the roles of protection officers and this service providers. Virtually, the service of summons to the respondent, husband, and other things are the primary duties of the protection officers are the service providers. But the hard reality is otherwise. Howsoever high in his rank, a person goes with casual dress, the people will not respect. If a police constable goes with the uniform, certainly people get scared and they respect the words of the police. This is the stark reality prevailing in our country. Therefore, the service providers or the protection officers might seek the assistance of the police personnel in serving the summons and serving the warrants or implementing the orders of the orders passed by the courts concerned. So under those circumstances, I request the police officers to discharge their duty immediately, because apathy is the order of the day, order of the society in our country. So lack of interest, we don't show interest in many matters. This is the hard reality. Of course, somebody may not accept my view, I'm sure, but still it is the hard reality. So what they do is they show lack of interest in serving the summons as far as these maintenance matters and protection order matters and other things. So I request the higher police officers who are here to send that message that they must show empathy and sympathy to the victims of these violent acts committed by the family members or outsiders. If we do that one, certainly the entire women folk in our country who are subjected to this cruelty will not and shall not forget the police officers' help. And of course, Madam Rohini said that scientific examinations. Madam used that word, scientific examination. Yes, that also play a dominant role in the system. Suppose a girl or the woman who comes to the court or approaches the protection officer or the service provider and makes the allegation that either her husband or relatives of the husband had subjected her to physical harassment or mental cruelty or whatever it is. So then the scientific examination is to be done. Scientific examination, everybody knows that, taking that lady to a medical officer, and if there is any other things, a detailed physical examination of that person, of that victim, has to be done. And if such a report is filed before the court as early as possible, certainly the judge or the court will be in a better pedestal to decide that whether there was any domestic violence or not. And of course, being the one of the stakeholders in the system, even the judiciary is not lagging behind in this connection. Of course, we cannot go as a judges, we cannot go and prevent this domestic violence being committed to any lady or otherwise. But Madam Rohini also spoke about the empowerment of the ladies. As far as that concept is concerned, in Karnataka, of course, I am sure even in other states also, this is in vogue. So every now and then, of course, once in a month or twice in a month in Karnataka, we conduct this legal literacy program, and we judges will go to every nook and corner of the state or the district or the unit where we are working, and we impart training and we educate the people about their rights, be it on family matters or be it on property side or whatever it is. So we regularly impart this training program, and the object is only to empower the ladies or the female folk of the society. Therefore, I believe that instead of trying a matter when it comes to the court, if we infuse that education to the women and children, certainly they will take necessary steps as and when occasion demands, and thereby automatically this violence against the woman or children gets reduced. I believe so. And the first speaker, Madam from Kerala, also said about the documentation. Of course, this is very important. What is the meaning of the word documentation? So that's as simple as this. Suppose the wife who is not educated, and she either approaches the service provider or the protection officer and says that my husband has got so much of income, but he is not providing any income. Suppose, any money to me or to my children, or he is taking snatching all my income and using for some other purpose, and he is not providing anything to me, even out of my own earning. So these sort of allegations are made by that victim. Certainly the service provider or police, protection officer are expected to collect some documents about her income or income of the husband or their family background, everything. But once again, I must say that the whole reality is that if some officers goes and request the authority concerned to give such documents, certainly they will not oblige. They will not oblige. So therefore, even on those circumstances also, the police will play a dominant role or important role. If they approach and if the higher officials of the police department give those suitable instructions to the authority concerned who maintain that documents, certainly they will oblige and they will give or provide all those important documents to the service providers or to the police officer concerned, and thereby if they are presented before the court, then the court will take suitable action and pass necessary orders in this connection, and thereby certainly the violence against the women can be combated. So therefore, I request that, including me, I am telling, all the judicial officers and the police officers or other NGOs who are present here, it is everybody's task and should become the motto to evaluate various modes through which we can combat the violence against the women in women. So therefore, so again, I reiterate, as far as judiciary is concerned, continuously the Karnataka Judicial Academy with the support of Karnataka High Court has been imparting training to the judges to get themselves sensitized on these issues, that to sensitize sensitive issues, and to do or to play a proactive roles in combating the violence against women and children. This is my submission and my view. Before parting, I express my sincere thanks to the organizers of this program for providing me this opportunity. Thank you.
Yes, thank you very much, Sri Bringesh sir, for sharing your opinion in this aspect. I really appreciate when you said that there are many times women is involved in making false allegations, and in such circumstances, it's very much necessary that she has to be subjected to scientific investigation to find out the veracity of her allegation. Timely scientific investigation is very, very important. And then you also said that you have been participating in sensitization of the judges. So because justice cannot be done unless the judge is sensitized. So thank you very much for sharing your opinion. But one thing here, which even Madam also, Rohini Madam also emphasized, and Sri Bringesh sir also emphasized, is about the empowerment of women, financial empowerment of women, educational empowerment of women, emotional empowerment of women. These are very important aspects. But I really doubt if we can thrust the burden on the government for her financial empowerment, because I don't agree with Rohini Madam when she said that we have to depend on the government also. To some extent only, I think we can depend on the government. What do you say, Bringesh sir? Can we thrust the responsibility on the government of making her financially independent?
Yes, it is, in my humble opinion, it is everybody's task. We are not supposed to entirely depend upon the government's policies or government only. As and when occasion demands or occasion arises, the persons who are doing these things or these actions must take upon themselves some task and do this empowerment, women empowerment programs, organize such programs and impart training. And I agree, and only to this extent, small extent, I also disagree with the Rohini Madam. It is not the entire sole task of government. This is my opinion,
sir.
Madam.
Yeah, sir. Thank you. Thank you very much, sir.
Thank you, Madam.
Thank you. Yeah. The other panelists, they have, due to their busy schedule and paucity of time at their end, they could not join. So we had only 3 panelists in this session, Dr. B. Sandhya Madam, Dr. Rohini Madam, and Sri Bungesh Sir. I thank all the panelists for sharing their wise opinion and field experience with our dignitaries who are present in this session, and they have enriched our knowledge in this aspect. Thank you all the panelists. And I also thank Department of Women and Child Development, Government of Karnataka, who has given me this opportunity of being a part of this discussion. I also thank Sudeshna, Center for Women's Studies, for giving me this opportunity. Thank you, Sudeshna.
Thank you, Dr. Jyoti. So that was wonderful panel discussion since morning, and now it's time for breaking for lunch. So we'll break for lunch now, and we'll reassemble sharp at 2:15, and we'll continue with the next 4 panels that are coming up. And till then, it will be a break, and the same YouTube link can be used by the viewers to continue the viewing of the conference also. Thank you all the speakers once again. And it has been a very pleasurable experience to be a part of this exercise. Thank you all.
Thank you.